Is it audible? Hello? Mic. Hello. Am I audible to everyone?
Yeah, you are.
As everyone joined the meeting, like every one of the teammates.
Can I take my default?
Hello. Good evening to one and all present here. Can every team confirm that all the teammates are present in this meeting right now? I'll call out the team numbers and each team member confirm their teammates' presence. So team number 1 will be team 53, team tired of trouble. Can they confirm all their teammates are here?
Hello, am I audible?
Yeah.
Yeah, all of us are present here.
Yeah, okay, thank you. Team number 2, 199 from Madras Medical College. Can they confirm their presence here?
1 second, Shirish has to join. Just a second. He's joining.
Can
everyone is here?
Confirm now?
Yeah, everyone is here.
Yeah, team number 3 will be team 74 from Maulana Azad Medical College. Can they confirm their presence now? Hello? Hello? Okay, moving on to team number 4 from Mysore Medical College. Can they confirm their presence now?
Hello.
Yeah, you're audible.
We are all present here.
Okay. And team number 5, Contagion from, can they confirm their presence now?
Yeah, we are present all three.
Yeah, okay. Team number 3, 74, are they present here?
Yes, sir, we are present.
Okay, fine. Okay, we welcome you all to the Infesto medical quiz conducted at Madras Medical College. This is the first event of Genesis 2023, and we are honored to host you as a finalist. And basically, there are totally 6 rounds in this final round, and each round will be conducted as a separate Zoom meeting. And the participants will be asked to exit the meeting and re-enter the meeting, which new meeting link, which we sent as soon as possible. Is that clear?
Yeah, okay.
Hello.
Yes.
Are we supposed to rename ourselves according to the team?
Yes.
Team number.
I'll repeat the team numbers and they can rename their team now. Team number 53 will be team 1. Team number 199 will be team 2. Team 74 will be team 3. Team 140 will be team 4. And team 5 will be team number 5. Should I repeat? I'll repeat. Team number 53 will be team 1. Team number 199 will be team 2. Team 74 will be team 3. Team 140 will be team 4. And team 5 will be team 5. I hope that's clear. Okay. Before moving on to the first round, I invite our academic secretary, Ms. Srinidhi, to speak a few words on this event.
Hi. Hello.
You're audible now.
Hi. To all the finalists. Surya and Janani to speak with.
Hello, is it audible or is it
So,
breaking?
yeah, it's audible.
Break आगे लगे clear आता है.
Hello. கேக்குதா? சூர்யா
Yes, கேக்குது.
கேக்குதா? அப்ப பேசுறது கேக்கலையா? இப்ப பேசுடா?
அப்ப பேசுறது கேக்கல. திரும்ப சொல்லு. என்ன சொல்லுங்க சொல்லு.
Okay, yeah, okay. So, hi everyone. This is Srinidhi, Academic Secretary of Madras Medical College. First of all, congratulations to all the finalists. You guys did an amazing job. It gives me very much pleasure to invite all of you to the finals of Infesto. Hope this will be a very good, amazing experience to all of you. I would like to call upon Surya to speak a few words.
Yeah, since we're running short of time, we'll move on to introduction of the participants. Can one of the teammates introduce themselves and proceed so far? Team number 1, can they introduce themselves?
Good evening, everyone. I am Debayan Bannerjee, final year MBBS student from Sekhri Medical College, Mumbai.
Good evening, I am Harsh Marathe from final year Sekhri. Hello, I am Devesh Dharmarajan, intern from Sekhri.
Moving on to team 2.
Hi, we are from MAMC, CRRIs. I am Sukrit, and my teammates are Praveen and Shirish.
Hi.
Team 3.
Hello.
Yeah, you're audible.
There's just a lag in starting the video. I am Tejas, and with me are Vidhi and Kshitij, students of MAMC.
Team 4.
Hello everyone, this is Akshay here. I'm an intern from Mysore Medical College.
And team 5.
I'm Shloka from BJMC Medical College, final year. My teammates are Nishad and Kushan.
Okay, that was a nice introduction. And can everyone switch on their video once? Team number 5. Your video is not visible. Is anyone facing an issue with switching on their videos? Okay. Okay. Before moving on to the next meeting, I'm inviting the round number 1 host, Karthikeyan AG, to enumerate the rules of this round.
Hello everybody, am I audible? Or is my voice audible and clear? If somebody can confirm it, I'll start with the rules of my round.
It's clear, sir.
Can you be a little louder?
Yeah, sure. Yeah, is this okay? Like, is this loud enough?
Yeah.
No, please be a little more louder.
Okay, so hello. Okay. Yeah, am I audible?
Yeah, you are.
Okay, right. So nice to see very familiar faces out here in the finals. So myself, AG Karthikeyan, and me along with my partner Lalit here will be conducting the first round. I'm sure all of you must have read the rules for our round. Or the name of our round is Javumita. It is actually a Tamil word for bubblegum. So it is a connection based round, and I'm pretty sure all of you are familiar with the pounce and bounce concept. So anybody who is not uh, familiar with the pounce and bounce based round, so if anybody has a doubt with it, I would like to explain it, or if nobody has a doubt, I can proceed with the next rules. So does anybody have any doubt regarding the pounce and bounce?
Is there self bounce?
No, there is no self pounce because all the pounce and the direct question both have the same points. So I don't think self pound is going to be valid here.
We have to pounce to which one, like home among the organizers.
Yeah, each team has a direct question directed to them, and the other team who does not have a direct question can pounce for that question if they know the answer.
Yes, I'm asking. Message should be directed to whom? Sent to whom?
I'll come to that. So with respect to the message being delivered to whom, if you can see the chat, there will be you have to send the chat to the name AGK. It will be sent to me. If you see the chat, there will be a name called AGK, and one person from the team can send a hi right now, and that will be fine. So if I see all the 5 responses from the team, it will be great. Okay.
Hello?
Yes.
Hello, I'm audible.
Yeah, you're audible.
So my doubt is like, suppose there is a question directed to me,
okay,
like team 4, and the other teams are given a particular time to pounce for it.
Yes.
So at what time am I supposed to answer?
Yeah, the pounds team will get 10 to 15 seconds approximately based on the length of the answer to pounds. And once I say the pounds time is over, now it is a time for the direct team to answer.
Okay, so
I'll just explain the rounds. Okay, so suppose there are 4 images for the connect, and the first image is very important with respect to our round because the first round, the first image will direct how specific your answer will be, because all these answers are very common infections. So obviously all of you will be able to guess it. So how specific your answer will be is based on the first picture. So we are not allowing any team to pounce with the first picture. Your scoring will start from the second picture onwards. So once I display the second picture, I'll give you the other teams 10 seconds to pounce. So once all the other teams finishes pouncing, I'll give the direct team an answer, a chance to answer. If the direct team wishes to go to the next clue, I will move on to the third image. Is this fine?
So we will get 10 seconds. I mean, the direct team will get 10 seconds to decide whether to choose the next clue or not, right?
Yes. And if the direct team is able to answer it right or wrong, the question ends therefore. No other team is able to pounce later. But if the direct team wants to go to the next clue, the other teams can also pounce for the next clue, but with a lesser amount of points. Is this rule fine with everybody? If you are able to answer the right answer with the second clue, it will be plus 30 or minus 30. If it is with the third clue, it will be plus 20 or minus 20. And if it is with the last clue, it will be plus 10 or minus 10.
Is there a negative for direct team also?
Yes, there is a negative for the direct team also.
Okay.
Can we pounce twice? Or
no, there is no pouncing twice. No. There is no
if
pouncing
we have
twice.
already
There is only a
attempted
single
it
correct
in the
answer.
second clue, we can't re-attempt it after the third one.
No. You are not able to do that. Even the direct team is not able to do that. If the direct team answers the question wrongly, the question ends therefore. There is no more progression in this question.
What if I come to the last question?
Okay.
And then still don't answer? Do you still get negative?
If you leave it unattended, you won't get any points.
For
the direct team, I say. the direct team won't get any negatives if they don't answer completely. If they pass the question, they do not get any negatives.
Okay.
There is a positive marks if you answer it rightly. There is a negative mark if you answer it wrongly. If you don't answer, you don't get any points.
Okay.
So I have got the pounds from team 1, team 5, team 2. So who Tejas, Sekhri, which team do you belong to?
We are from team 3.
Okay, so team 4, I don't think I've got a pounds. Okay, Akshay, I've got pounds. Okay. So I think all 4 teams have know whom to direct your answers to, right? It is to AGK. So is there any other doubt that you need to clarify? We can proceed with the next round in the next meeting, right?
Yeah, this meeting will end in 5 minutes and the link for the next meeting has been sent in the group. I request
Can you also share the entry code and password?
Yeah. It has been sent to the group.
Okay.
I request the participants to exit this meeting and join the new meeting. Thank you.
We meet again. Has all the teams arrived? Team 1 is here, and team 2, I guess only one participant is here. So we'll wait a few minutes for the other teams to come. Is the screen visible for everybody?
Yes.
Okay. So any other queries with respect to the round or the rules?
Can every team confirm that they have joined the meeting?
Team 1 present.
Team 2 present.
Team 3, are you here? Okay, team 4?
Yeah, team 4 is here.
Team 4, everybody is here. And team 5?
Yeah, team 5.
Team 5, we had a doubt, like in past, if we, give, like we didn't give the specific, but it is related to that. So we will get negative for that, or?
It is a relative answer. If you answer it very closely, I might not give you a negative, but I'm pretty sure I won't give you a positive.
Okay, but like we won't
give you a
negative,
negative.
right?
If it is too vague, I mean. But if it is close, I won't give you any negatives.
Okay, thanks.
For example, if the answer, I give you a direct immunofluorescence of a fishnet pattern, and if you say it as pemphigus, I might not give you a negative, but if I had given you a desmoglein 1 or 3, you have to be very specific that whether it is pemphigus foliaceus or pemphigus vulgaris. Fine, if you say it specifically, you will get to the positive points. But if you are not specific enough and you say it is pemphigus, I won't give you any points. But if you say it is at bullous pemphigoid, I'll give you a negative. So is this example okay?
Yeah. Thanks.
So can we begin with our round? So team 1, 2, 3, 4. I assume all of you are here. So the round progresses from clockwise to anti-clockwise direction. There will be 10 questions. The first question will be from the first team, and the sixth question will be from the fifth team. So all the teams will get 2 questions for themselves. So we'll go to the round per se. Next slide. These are very famous movies from down south, I would say. So team 1, which movie would you like to choose?
Vikram.
Vikram, very nice movie. Have you seen Vikram actually?
Yes.
Okay, right. So here comes the first question. The pounds teams, be ready to pounce. This question has no pounds. This question is open for everybody. You can just see the image.
Hello, am I audible?
Yes, sir, you're audible. Continue.
So yeah, I'm gonna reveal the second clue, and the pound starts from there on. And within 10 seconds, I'll be closing the pounds, and the respective teams are asked to send their responses to AGK. Is that fine? Hello.
Yeah, got it.
Yeah, okay. So here is the second clue, and the pound starts. So your 10 seconds are over. I'm closing the pounds.
So is there
now
any
the
final
direct
pounces?
teams.
I have got 2 pounces received, so I'm closing pounds right now.
Yeah. Okay.
Hello.
Now,
Hello. Can
Yes.
you confirm if we sent it within time or we have to send it again? One team.
No.
Team 4.
Team 4 and Team Mysore and Team MMC have sent their pounces and both have been received. There are only 2
Okay.
pounces which I got.
Okay, thank you.
Okay. Now it's time for the direct team to answer.
The answer is onchocerciasis. It is showing leopard skin and skin swellings.
Yeah, it's correct. So what about the pounds teams?
Yeah, so scorers please note, Team 1, Team 2 and Team 4 all get plus 30. Team 2 and Team 4 get a plus 30 on pounds and Team 1 gets a plus 30 on direct.
Just a minute.
So scorers, could you please acknowledge? 3 teams have got plus 30, Team 1, Team 2 and Team 4. Okay, so we'll move on to the next question. Next slide, please.
The slideshow is not moving forward.
Yeah, it's the same problem for me as well. I'll just confirm it in a few seconds. So this was actually the third clue. It is the hanging groin.
My screen is not changing. It is still in the first question.
Yes, sir. Yes,
even
sir.
mine.
It is still in the same question. It is still in the third
Okay.
image. There seems to be a small network error from the admin side. We'll be correcting it soon. Few minutes, please. Thank you.
Yes, ma'am, it's fine. Hello, AG sir. இப்போ ஓகேவா? Yeah, okay. I will.
You have stopped screen sharing, by your
Yeah, yeah, ஆமா திரும்பி பண்றேன். இப்போ ஓகே.
So I guess we have come back to the hyperlink slide again. Is everybody able to view the slide?
Fine.
Okay, right, fine. So sorry for the technical glitches. So can we move on to the second team? So second team MMC. Legend as usual. We go on to the next. Okay, so this is a very interesting question. This is more a trivia based of question. The first image. So as a clue, I would say that think with respect to movies and infection. I think you know who this personality is. So all of you get some 10 seconds to gauge what I am asking in this question. So we'll move on to the next picture. So this is direct to team 2. Next slide, please.
Yeah, the pound starts from now on.
The pound starts from now on, and we have to pounce to the name AGK. So you get 15 seconds to pounce, and any team who wants to pounce can pounce. Okay. So I have received a pounce from team Mysore, team 4.
So I'm closing the pound, sir.
So any other team who wants to pounce now can pounce. So we'll be closing the pounce now. So the pounce is closed, and the direct goes to team 2. So team 2, if you would like to attempt this question or have a go at the next clue.
Next clue.
So except team 4, all other teams can pounce now. And with respect to team 4's pounce, I will be saying it at the end of the question, the marks for the pounce. So the next slide, please. Okay, so this is a very iconic image. I guess many pounces will be coming right now. So all the other teams can pounce. So I've got a pounce from team 1. And I've got a pounce from team 5. Any other team wishes to pounce? Team 3. So
I'm closing the pounds, yeah.
Yeah, we are closing the pounds now. And team 2, can you answer the direct?
Next clue.
Next clue, sir. Okay. Next question. Next slide, please. I guess this is a nice giveaway image. There is still one team, team 3, if you would like to pounce now. Team 3, I give you last 5 seconds to pounce if you want to pounce. So we'll close the pounce. Okay, team 3 has also pounced. So team 2, can you give your answers, please? Sir, I think you are in mute and talking. Can you?
Am I audible?
Yes, sir.
Yes, sir. இப்ப கேக்குது.
Is it malaria?
Malaria is not the right answer, sir. So we'll see what the answer is. So all the other teams who have pounced had got it right. It is parvovirus B19 infection. So what I was coming to say here was the second image is dog ear inclusions. And the third image is a slapped cheek appearance. We obviously know what happened at the Oscars. And the fourth image is a normal person is not afraid of parvovirus, but it's not the same for a person with hemolytic anemia. He'll have an aplastic crisis. And with respect to the first one, this is the trivia where in 2007, Will Smith actually acted in a film known as I Am Legend, in which parvovirus B19 was the main virus. So I'll tell you the points for this question. Team 4, Team Mysore gets a plus 30. Team
Yes, sir.
1 gets a plus 20. Team 5 gets a plus 20. Team 3 gets a plus 10. And Team 2 gets a minus 10.
Yes, sir.
Okay, so I hope the score is noted. We'll move on to the next question.
For team 4,
Team 4, it's a plus 30. You answered
It's a
right
plus
on the
30.
first one. It's a plus 30. Team 1 and 5 get plus 20. Team 3 gets plus 10. And Team 2 gets a minus 10, unfortunately. So we'll move on to the next question. Hyperlink slides, please.
Hold on. Just a minute. Yeah.
So team 3, it is your chance to go for the hyperlink.
We choose Adipurush.
Adipurush. Let's see what Adipurush holds for you.
Hello. Yeah. I'm gonna reveal the second clue, and from there on, the pounds will start for 15 seconds. And as always, you can send your responses to AGK, and the pound starts.
So team 5 have pounds for this question. Any other
Okay, I'm
team who
closing
wants
the
to
pounds.
pounce? We'll close the pounds now.
Hello.
So we have closed the pounds, the direct team.
Yeah, it's time for the direct team to answer.
Yes, so we think it's cutaneous leishmaniasis.
Team 3, we actually wanted a more specific answer. We'll give you one more chance to answer because it is quite close. You have to be quite specific.
Okay.
Either you can go for the next clue or you can answer.
Could you please repeat?
What?
Could you please repeat what you said?
We want the
Yeah, you can
specific
either go for the
answer.
next clue. If you want to give us more specific answer, we'll give you a plus mark or the negative mark, or else you can go to the next question. So I think we'll move on to the next question because there is a shortage of time here. Is it okay, team 3? So we'll move on to the next slide. Next slide.
Won't we get another hint?
With respect to, you will get another hint. Yeah, the third image. So the other teams can pounce, except team 5, no other team has pounced. So the other team can pounce now. So I'll be closing the pounce in 5 seconds. So I close the pounce. Team 3, you can say your direct. Yeah, I actually gave you a big clue that you are quite close. So if you can be a bit more progressive with your answer, you will come to it.
I'm not sure. Do you want the organism or do you want
No, I want its presentation. I want its presentation. It's not an organism that we are finding about. It is a presentation.
As AG sir said before, the first clue will be the specific one around which you should say the answer. So yeah.
Yeah, so we'll move on to the fourth.
We'll answer Leishmania recividens.
I'm sorry, team 3, it is the wrong answer. So because you said the wrong answer at the third clue, I will have to give you a minus 20.
And I'm closing the question, sir.
So Lalit, please reveal the answer.
So the answer is PKDL, post-Kala-Azar dermal leishmaniasis. The first picture is non-ulcerative skin lesion, which is seen following treatment with antimonials for visceral leishmaniasis. And the second one is sodium stibogluconate, which is the antimony compound which does not accumulate. And the third one is DART, direct agglutination test. And the fourth one is L-Donovani.
So the points for this question, it is team 5 gets a plus 30 because they answered in the pounds right in the first question itself. And team 3, you get a minus 20.
So scores once again, please. Sorry.
Team 5 gets a plus 30 and team 3 gets a minus 20.
Okay.
Lalit, we can go to the hyperlink slide, please.
Yeah, okay.
So team 4, if you can choose your hyperlink.
Vishwarupam.
Vishwarupam. Okay, you've gone for the other legend. Okay, Vishwarupam. So here comes the first image. I think if you are very familiar with newspaper, this is a very good giveaway. I think all of you know what this animal is. So this is a differential diagnosis for a panda, I would say. So we'll go for the next clue. So next clue.
And the pound starts.
The pounds time starts. Okay. So as I said earlier, be very specific with your answers. Integrating all these clues will give you the right answer, not one picture, because all of you are quite capable enough to find one picture and find the answer, but integrating all 4 gives you the marks. So no teams have pounced as of now, so we close the pounds. So team 4, do you wish to go for the direct?
We'll take the next image.
Okay, next image, please. Okay, I think this is a good giveaway. So all the other teams get a chance to pounce now. So your pouncing time starts. I think everybody knows what this instrument is, or perhaps seen it in movies. So team 3 has pounced. Team 1 has also pounced.
So I'm closing the pounds.
Okay, so 3 teams have pounced. I have got pounced from team 3, team 1 and team 2. So we have closed the pounds, and Akshay, can you give me the answer?
Is it lymphogranuloma venereum?
Yes, exactly. This is lymphogranuloma venereum. So this is the saxophone penis, I guess. So this will be a good giveaway. And all chlamydias are very favorite for koalas. All koalas have chlamydia because chlamydia is an infection which has auto-infection in all these koalas, and this is genital lymphangitis because this is a differential diagnosis for filariasis. So I'll give the points for this. Team 3, Team 1, Team 2, and Team 4. All of you get plus 20 points.
Okay.
Okay, so except Team 5, all other team gets a plus 20.
Yes, sir.
So the next image was actually an STO mean. So we'll go back to the hyperlink slides. So Team 5, this is your direct. Team 5?
Indian.
Okay, so this is one of my favorite questions. I think everybody will know who this famous personality is or this famous post. So I'll give you 5 seconds to analyze whatever is going to come next. So the next slide, please. Okay, so I guess all the pounces will be raining now. The pounce time starts. So I got a pounce from team 1 and I got a pounce from team 2 and team 3. And I'm not sure how all three have this telepathic connection. All three have answered the same answer. Very nice. So, team 5, I'll close the pounds now. Can team 5, if you want to answer this direct question? Team 5.
Next image, please.
Next image. Okay, cool. So we'll go for the next image, Lalit. I 2-3 teams can wonder why they answer the first question like that. So okay. So I guess only team 4 is left to pounce for this question. If team 4 wants to pounce, okay, team 4 has pounced. So team 5, if you want to give your direct answer.
Scabies.
Scabies, yes,
Sarcoptes
scabies. This is an excellent answer. So it was actually not ballerina skirt appearance as all team 1, 2, and 3 had expected. It was actually Marilyn Monroe. Marilyn Monroe acted in a movie called as The 7-Year Itch, and 7-Year Itch is called as scabies. And it was in that movie that this scene had actually come from. And and the clue 2 is the hanging glider sign seen in scabies, and obviously the third image is circle of Hebra. So I think team 1, 2, 3 missed out on a very good opportunity. So I'll give the score for this round. It is minus 30 for 1, 2, and 3, and it is a plus 20 for 4 and 5.
Yes, sir.
Okay. So we'll go to the hyperlink slide.
Now it's team 5 again, I guess.
Okay, so team 5.
Beast.
Beast, okay. Very nice.
Yeah. Now I'm giving 5 seconds to analyze, and then I'll reveal the second clue. So yeah, here is the second clue, and the pound starts.
I have received bounce from team 2. Any other team wanting to bounce?
Sir, I'm closing the pounds. The 15 seconds is over.
Okay, so
Now it's
bounce
time
closes,
for
and I've
the.
got one more response from team 3.
Okay. Now it's time for the direct team to answer. Team 5. You want the
We
next
also
clue?
pounced. Yeah, team 2 and team 3 has pounced.
Yeah, so team 5 would like to answer.
Okay.
Yeah.
Zika virus.
Yeah, it's correct. So team 5 will be getting plus 30. The first clue is plaque reduction neutralization test, and the second one is the carrier. Now I'll be revealing the third clue, and this is the congenital Zika syndrome, where you'll be seeing the skin folds and microcephaly. And the fourth one is from where it all started, in the Uganda Zika forest. The monkeys were the reservoir, and henceforth the name Zika virus. So, sir,
So
what
I'll give
about
you
the
the score
pounds?
for the pounds. Team 2 and Team 3 both get it right on pounds, so plus 30 for them.
Team 2 and?
Team 3.
Okay. And Team 5 is also getting plus 30. Okay.
Yeah, Team 5 is getting a plus 30.
Okay, so now I'm going to the next hyperlink slide. Yeah. Now it's
So
Team 4, yeah.
What is remaining?
You have
Adipur is
Dasavadaram remaining. You have
Adipur is done. Adipur is done.
Yeah, Adipur is over.
Yeah, that only gave all of you a negative. One team, 1 to 3 negative, I guess.
The fourth one is done, no?
The fourth one,
No, fourth
Dasavadaram,
one
no,
is
it's not done.
No, it's not done.
Okay, we'll go for that.
Okay.
Okay, so this is a nice question. Okay, so this is I think this is a question in which nobody should get a negative, I assume. So always think before answering. So I think all of you are familiar with whatever is happening in the first image. And I'm saying before pouncing, think twice and pounce. So next clue, please. Okay. So this is a very familiar oral lesion. Any pounces now? But always remember the first clue in our round is going to be the clincher. So the pounce, I'll close the pounce now. Nobody is any team wanting to pounce, so the pounce is closed. So team 4, do you wish to answer with this?
We'll take another clue.
Okay, thank you. Team clue 3, please. Okay, now I think any other
I think
pounces
it's
from other
close,
team? Okay, team 5, I'll give you one more chance because I said be very specific. Because your answer is general. So a very specific answer would also not give you a point. I'm saying give a very specific answer. Any other team wishes to pounce? Team 5, I'm giving you just one more chance to pounce because you are close. If you want to pounce, you have 5 more seconds. Okay, I'll close the pounce now. Okay, team 3 has given a pounce. Okay, with this
Hello, we submitted the another answer.
Okay, fine. Okay, I'll consider both your pounces, team 3 and team 5. You have given a pounce at the third clue. So team 4, will you like to answer this question?
Is it transfusion associated syphilis?
Excellent. This is actually the right answer. So this is actually a transmission of associated syphilis. This is called syphilis D. Abel. I expected many of you to say secondary syphilis, which is actually wrong because secondary syphilis has to occur after primary syphilis stage. But in a blood transfusion associated syphilis, there is no primary syphilis at all. So that is why if you see all the images, there will only be stages of secondary syphilis. And there will be a blood transfusion image given before itself. So I think only team 4 gets a plus 20 and team 3 and team 5 who had pounced, I'm unfortunately sorry, you have to get a minus 20.
But sir, it was not you said that if it is not absolutely correct, not specific enough, till we will not deduct any marks.
Yes, I was actually I think I said it quite a lot of times. Be very specific for this answer.
Your voice is not audible. Could you please be louder?
Okay, so yeah, I was like, be very specific for this question because that's why I'd given the blood transfusion image in the first itself. This is actually called syphilis D. Abel. It is like D. Abel means running away. So syphilis has run away from the primary syphilis. So an answer of secondary syphilis may not be the right answer for this question. So that is why.
But sir, it is still, it has reached the secondary syphilis stage. So I would contest the fact because I feel it is accurate. It is not inaccurate or incorrect in any way.
I may not give you the entire plus 20, but I'll give you no negatives. Is that fine?
Yes.
Okay, so team 3 and team 5 need not get a -20 for this question, but team 4
Okay,
will get
sir.
a +20.
So no one is getting negative, only team 4
Only
is getting
team 4.
plus 20.
Only team 4 will get
Yeah,
a
okay.
+20. Okay. So we'll go on to the hyperlink slide.
So we are left with Unnai Pol Oruvan, Heram, Valimai, and yeah, that's all. 3 questions only.
This movie 25.
Sorry, I'm not getting it.
Enable Oruvandra.
Yeah, okay. Okay, this is the first clue and giving 5 seconds to analyze. Then I'm starting the pounds.
Okay. So the teams, you have 10 seconds to pound quickly.
Yes, sir, I'm closing the pounds. We are running out of time.
So I have not received any pounds from any team. So we'll go on team 3 if you wish to answer for the direct.
Sorry for the interruption. This meeting lasts for next 5 minutes, so.
Sorry, I think
No, we'll take the next
5 minutes.
Sir, I guess we'll finish the round. So
Okay, so team
5 minutes we can finish, I guess. Okay, now revealing the next clue. And the pound starts.
Okay, Akshay, I'll actually take your pounds as the third with the third image because you pounced after the time. Okay.
I'm closing the pounds. The 15 seconds are over.
So, team 4 has pounds and team 3 has pounds. Any other team has not pounds. So I'm closing the pounds now. Team 3, if you want.
Team 5 was also pounds. Team 5.
We've sent our answer.
Yeah, pounds. Sorry, thank you. So team
Achha,
5 has
बिल्कुल
pounds,
कर
team 1 has pounds. Team 4 has pounds.
Yeah, the direct team can answer.
Okay.
The RDS is.
Yeah, it's correct. The first one is variant surface protein, which is responsible for antigenic variation. The second one is Beaver's disease. And the third image is entro test. And the fourth one is binary fission at the duodenum by the professor. Yeah. So, sir, the scores.
So the score except team 2, all other teams gets a +20.
Okay. Except team 2, everyone is getting +20.
Everyone gets a +20.
Okay. Team 2, you can choose your hyperlink.
Valimai.
Okay.
Same meeting,
Same meeting or we have to join the.
There is only 3 more minutes and 2 questions.
We have 3 more minutes. We can finish. Yeah.
Okay.
Yeah. Now the pound starts, and I'm revealing the second clue.
Same meeting.
Yeah, sir. I'm starting the pounds.
So you can start pouncing. You will have 10 seconds to pounce.
Yeah.
So these are very characteristic lesions. Team 1 has pounced.
Yeah, the pounds time is over. I'm closing the pounds.
Okay, the pounce is closed and only team 1 has pounced as of now.
Yeah, okay. Team 2 can either choose to answer or they can go for the next clue.
We want to answer.
Yeah, okay, sir.
We have also sent the pounds.
So team 3, right? Yeah, I received your pounds, but I'd actually closed it by now. If team 2 didn't answer, okay, fine. You actually sent it at the last month. Fine, okay. I'll accept your pounds, team 3.
Hello.
Sir, you can now answer. Yes, sir.
Team 2, you can answer.
Adult T cell lymphoma. HTLV1 flower cells are there.
No, sir.
No, sir. Unfortunately, yeah,
Okay.
it was similar to that, but the skin lesions were actually quite specific. So,
yeah. Yes, sir.
Okay.
Now I'm revealing all the clues and the question gets over. Now we would have known the answer. Joint fluid, there is polymorphonuclear cells, and the second one is disseminated erythema marginata migrans, and the third one is the tick, and the fourth one is BSK medium.
So this is actually Lyme's disease.
Yeah,
so
Lyme's disease.
Only team 3 gets a plus 30, and team 1 and team 3 both answered 80 HTLB only, so they get a minus 30.
1 and 2 are getting minus 30, 3 is getting plus 30.
3 is getting a plus 30.
Okay, sir.
So I think team 1 has only 1 remaining.
Yeah.
Can we go to the next meeting? Next meeting will continue paniroma. There is only one.
Sir, one more minute left. I guess we can go.
We'll go to the next meeting. Next meeting we will start.
Fine. Okay, sir. Okay.
I'm ending the meeting now.
கேக்குது இப்பதான் கேக்குது.
Okay, so team 1, can we continue with your question? Team 1, have
Yes,
you logged in?
Yes, we are ready.
Yeah. So Lalit, so Heram is the last typer, right?
Yeah, yes, sir.
Okay, so this is the first image. Okay, a characteristic person. I think this is a very narrow question now.
Multiple sclerosis. Multiple sclerosis kind of liver hai.
Team 5, Nishid, actually you are unmuted. Can you mute, please? Okay, so we'll move on to the next question, next clue. Now I think all the teams are going to pounce. Pounce, please. You can actually bounce it to AGK as usual. So I have received a bounce from team 3, team 2, team 4. So team 1 is it, team is 1, okay. Team 5, if you bounce, please. So do you want to bounce team 5? Okay, I'll close the bounce right now. Team 1, so this is your direct.
The answer is hepatitis B virus.
Yeah, excellent. It is hepatitis B virus. Yeah, it is hepatitis B virus. It is the Australia antigen, and Amitabh Bachchan is a hepatitis B survivor. And the third clue was genetic cross deletion, and the fourth clue is a recently approved drug for hepatitis B. I think team 5 missed out on a very easy connect. So I think this is the end of our round. Thank you.
Score, sir.
Yeah, I think we'll reveal the scores as it has been calculated. So the pounds for this is team 1, 2, 3, and 4 all get a plus 30.
Okay. All except 5 are getting plus 30.
Yes.
Okay. 5 is getting
no marks.
0.
No marks. 5,
Okay.
5 doesn't have any.
Okay.
So thank you all for your patience, and this is my round. So we'll move on to the next round.
Hi everyone, this is Janani. Is it audible? Can anyone confirm it?
Yeah, it's audible.
The screen visible to everyone?
Yes.
So I will be conducting this unseen round with my Yashwant. So I hope you would have gone through the rules. I will go again with the rule slide. If any doubts, you can ask. So we are having two parts. I will first start with the rules of part 1. After the part 1 is over, we can go with the part 2. Sir, next slide. Sir, next slide.
Yes, Janani, it's audible.
Sir, next slide, sir.
Guys, 1 second. I'll just be back in a second.
Can we start?
Okay.
We are actually having network issue. Please wait for something.
Sorry for the inconvenience. Wait for a few minutes.
Okay, is it audible? Sir, next slide, rule slide. Okay, there are totally 3 different questions for each team, and 2 minutes will be given for each team. All the three questions, which will consist of one random any short question. Second question will be a connect, and third question will be an XY type of question, or to be answered within the given 2 minutes itself. You can divide the 2 minutes as you wish. No fixed time for each question. You can skip the question and then come back to the question once skipped. Each question, if answered correctly, you would be awarded with 10 points. If any answer wrong means 5 points will be deducted. Only for the XY type of questions, you will be given partial 5 points. For other questions, no partial marks will be given.
if you're answering any one part and all. So no pounds and no bounds. Quizmaster decision is final. And as time is short, only 2 minutes, and the questions are only 1 or 2 lines. The question will be. So I think we no need to read the question. We'll be displaying the questions. You can start answering as you get it. And remember, if once answered wrong means you won't be getting another chance to answer it. But you can skip it and then come back to other the same question.
If we skip it and decide to not come back, will we get negative?
No, sir. Skip the questions, no negatives.
Okay.
So can
If
we
you
go to the
answer
questions?
wrong, we will get negatives.
So can we go to the hyperlinks? Okay, then. Okay, sir, next slide. So we'll be starting with team 1.
Hello, we'll choose MS Dhoni.
Okay.
So the timer starts now.
You can answer or skip.
Skip.
Next question. Sir, next slide. This is the connect.
We want a specific answer for the connect. There are no partial marks for explaining the pictures. We want the specific diagnosis or answer for the connect.
Specific answer.
Skip.
Next question. So next slide, Paul.
See, ये है. Why is cryptococus? And
connect वाला कर देना. Can we go to the previous question?
Sir, previous question connect Paul.
Sir, connect question. Previous slide, sir.
टाइम जा रहा है. DMV का और HIV का कनेक्ट कैसे
Already connect question.
For connect, we give answer as HIV.
No, you're wrong. So we'll be getting -5.
Is वही तो सेल होगा जो जाता है ब्लड ब्रेन वगैरह क्रॉस करता है. हाँ 6 X is like Naegleria or
The time is up.
The time up.
amoeba. सब बोल दिया तुमने.
Actually, time is up. So we are going to the answer slide. Sir, answer slide. Sorry, there is again the network issue. Please wait for some time.
Okay, guys, I'll just share the screen. Wait. So is my screen visible here?
Yes, sir, it's visible.
தெரியுதா? Okay, right. Fine.
Yes, sir.
Okay தானே?
Okay, sir. PPT போங்க.
மூவ் ஆகுதுல?
அதே சைடுல தான் இருக்கு.
சார் பிபிடி இன்னும் வரல, அதே ஸ்டேட்ல இருக்கு.
உங்க ஹைப்பர் லிங்க் ஸ்லைடு வரல?
அப்படியே ஓபன் ஆகல சார்.
வெறுமா அந்த ஸ்கிரீன் தான் தெரியுது.
என்னோட எந்த ஸ்கிரீன்டா தெரிஞ்சது?
சார் உங்க லேப்டாப்ல அந்த எல்லா டாக்குமெண்ட் ஸ்கிரீன் தான் தெரிஞ்சது, பிபிடி ஓபனே ஆகல.
அப்படியா? ஃபைன். சரி, ஓகே வெயிட்.
இப்போ வருது.
இப்போ வருது.
இப்போ கனெக்ட் வருது.
சார் ஏஜி சார், நீங்க ஸ்டாப் ஷேரிங் பண்ணாதீங்க. இங்கே ஷேர் ஆயிடுச்சு.
ஃபைன்டா, ஓகே.
சார் ஆன்சர் ஸ்லைட் போங்க சார்.
சார் ஆன்சர் ஸ்லைட் போயிடுங்க. தெரியுதா? இன்னும் வரல.
கைடன்ஸ் கன்சிடர்.
இப்ப தெரியுதாடா?
தெரியுது சார். சரி, உங்களுக்கு டோனியோட ஹைப்பர் லிங்க் ஓபன் பண்ணுங்க. அதுல ஆன்சர் ஸ்லைட் போங்க சார்.
ஆன்சர் ஸ்லைட் போடுங்க.
டைம் முடிஞ்சிருச்சு, ஆன்சர் ஸ்லைட் போங்க.
Okay, the answer for the question is first one the Penicillium aeruginosa. Then next one actually it is Malassezia purpur. Sorry, Malassezia purpur. And second one is cardiac papillary fibrillostoma due to CMV infection. You could have seen the immunocompromised HIV, then the histopathological site for papillary fibrillostoma and CMV inclusions. Then X is acanthamoeba and Y is Legionella. Acanthamoeba acts as a Trojan horse for Legionella. So can we go to the hyperlink? Is it okay? So team 1 gets -5. They have answered one wrong, so -5.
We will get marks for acanthamoeba. We answered it.
No,
actually, you answered after the time is over.
The time. And I think you were like, it was like discussing. You didn't get the full answer. You said it after the time also. So sorry.
No problem.
Thank you. So next
team 2 sir hyperlink choose பண்ணுங்க.
கோலி விராட் கோலி.
தெரியும் சார். Sir, identify the mediator mark there, sir. Black box.
Can I tell?
Yes sir, சொல்லுங்க.
So that can solve, sir.
DC sign.
Yes sir,
correct,
right?
sir.
Plus 10.
Next slide.
Next
slide, sir.
Next one.
Sir, Reddy sir, next slide.
Next slide.
Sir,
correct. This is correct.
Trench adana?
Correct sir.
Trench fever.
Yes sir, correct.
Okay,
sir.
correct. Next slide.
Quinta.
Reddy sir, next slide.
So identify X and Y.
Sir, X and Y identify பண்ணுங்க.
Hello.
அதுதான் வெயின் கார்டன் மேயர் கோவனார்.
Yes sir, correct sir.
X Y 37 சொல்லுங்க. Okay. Yes sir.
So team 2 answered all three correctly. They are getting plus 30 points.
Plus 30.
Sir, AG sir, answer slide. The first question, the answer is DC strain. The second one, it's trench fever for the connect. You can see the World War I picture or something. Then trench fever is also called 5 days fever. So we have put the 5-star symbol there. Then the symptoms like arthritis are put over there. Then for third question, excess Weingarten and which is associated with sphenomegaly, sphenomegaly, that's mere COVID. Okay, now let's go to the hyperlink. Team 3, choose your hyperlink.
Sachin Tendulkar.
Sir, Sachin sir. Sachin hyperlink open பண்ணுங்க.
Yes sir.
First question.
एंटमीबा हिस्टोलिटिका, जियार्डिया और तीसरा कौन सा होता है?
You won't get partial marks, so you have to tell all three. So last one.
So we'll come later. Please show us the next one.
Okay. So next slide, sir.
Next.
This is a connect question.
Cellosis.
Next connect.
Next. Brucellosis.
Yeah, correct.
Yeah, okay,
next
right.
Identify Y and Z in this question.
This is, क्या कहते हैं उसे? Adhesins की. Piracy of adhesins is the phenomena.
Okay, yeah, right.
Okay.
Why is the secondary infection? Why it addition? GRD and
no, why is strong,
in the first one?
Why is a factor they have to tell?
No, the first
facilitates. No, first one wrong. Not stronger light soul.
Okay,
And
first one.
And why
By trying
promote
to attempt.
secondary infection by IgA नहीं वो filamentous hemagglutination बताओ FHA हो सकता है या फिर
Can you tell one final answer? You are coming with many answers. Can you tell one final answer? Only 30 seconds more.
Filamentous heme.
Yeah. Okay. Right. Fine.
Filamentous hemagglutination.
Yeah. Right.
Fine.
Right.
Trying to attempt the first one. The three antigens, three organisms.
No, we told you. It's a crypto.
Okay. Actually. Okay. You said cryptococcus. It's wrong. So just cryptosporidium.
So team 3 answered question number 2 and 3 correctly, plus 20 for it. Question 1 is wrong, so minus 5. So totally 15 points, plus 15 points.
So team 3
hyperlink,
are
sir.
getting plus 15.
Team 4 selected hyperlink.
EBD.
Sir, Devesh, sir. Yeah, identify the motility shown here.
And the organism.
Listeria tumbling motility.
Yeah, right.
Next one.
Next question, sir. Second question. We need a specific answer.
This is a facial hepatic causing that laryngeal edema.
You need to be specific with that syndrome.
Yeah, that one, right? Madras syndrome. This one.
Yeah, you're right. You're right.
Yeah, you're right.
Third one.
Next one. So 30 seconds more. Please be fast.
20 seconds more.
Is Y L16?
No, wrong.
Sorry,
so
wrong.
X, can you attempt?
No, we don't want to attempt.
Okay, but you're getting -5 for attempting.
Okay,
wrong.
the time is also up.
Yeah.
Sir,
Answer
sir.
slide.
So the first two questions are answered correctly. Third one, X is either abiotropia or granulocatala, anything could be answer. Y is vitamin B6. Pyridoxal is required in the culture media for their growth. So you answered first two questions right. So plus 20 and third one -5. So plus 15 for team 3.
Team 4 then.
Sir, hyperlink, sir.
Team 4 then ಇದು.
Oh, sorry, team 4. Sorry.
Team 4 is getting plus 15.
Yeah. Team 5 choose
So team
hyperlink.
5.
We would go with Kane Williamson.
Sir, Williamson.
You have to name this reaction.
Next question.
Next, connect போங்க.
Adenovirus.
Yeah, right.
Yeah, right.
Next.
Question.
X actinomyces causes an actinomycetoma Welsh regimen.
Okay, you have
Can
to
you come again
expand
with
the
X?
research.
Madurella mycetomatis.
Yeah, X is right. Can you expand Welsh regimen? Modified Welsh.
Modified Welsh regimen.
You have to tell what all there in the modified Welsh regimen.
Yeah, cotrimoxazole plus gentamicin.
No. No, you got the expansion wrong. So can we go for the first question that you missed?
Yeah, go to first question.
So time.
So only 15 seconds more. Time up.
Okay, skip, yeah.
Sir, answer slide. So the first question answer is Watchman reaction. Second question you answered right, it's adenovirus. Third question, actinomadura and modified Welsh regimen you answered. The regimen is amikacin plus cotrimoxazole plus rifampicin. So the points.
But wasn't the regimen asked? Like Z was the name of the regimen asked, right? And
Yeah,
we say
okay,
we
okay,
said
points for it.
We will give points for that.
Plus, we will give points for it. Okay, 2 and 3 is right, so plus 20, and one you didn't answer, so no negative marks for it. So plus 20 you are getting. Sir, again, hyperlink, sir.
Okay, all titles students. So part 2.
Yeah, now we go part 2, sir. So we are moving to part 2. There are totally 4 cases which is open to all the teams. So it's like a pounds only. You have to message me in the Zoom. So 1 minute to answer each question after. Yeah, you have to message me, Yashwant. Then 1 minute to answer each question after the quizmaster finished reading the case. For the correct response, you will be awarded. So there are 2 questions for the case. One is the main question, which is the diagnosis, and there is a sub question. For the diagnosis part, it's plus 20 and minus 10. And for the sub question, it's plus 10 and minus 5. Okay, so let's start. Sir, first question.
Are
the rules
okay
clear?
for all? The rules clear.
One second.
Yes,
Okay.
sir.
If answer should be done to chat.
Sir, chat. It's open to all teams. Sir.
ஒரு செகண்ட் ஹாய் மட்டும் அனுப்பிச்சிடுறேன்.
Okay,
for every team, for all the teams, please send a hi to Yashwant. Okay, all the 5 teams.
Yeah.
Hello. We have to answer to the AGK, right?
Can you come again?
We have to answer to the AGK chat, right?
No, Yashwant. You have to answer to Yashwant.
No,
Yashwant.
4 teams have replied.
Hello, this is team 4.
Yeah.
Yes.
So the 4 cases are open for all the teams. So for the diagnosis, I'll get a separate 1 minute, and for the sub questions, there is separate time.
No.
Totally it's 1 minute.
Okay.
After reading the case, we will read the case. Yeah, we will read the case. After reading the case, only we will start the timer. It's 1 minute after.
The question will be like the what is the diagnosis, and the sub question will be in the same slide. So within 1 minute, you have to tell both. You have to type them both.
Hello, sub questions will
there be part marking?
Yes, sir. That only for the diagnosis plus 20 and plus 10 for the sub questions. If you are getting it wrong, it is minus 10 and minus 5.
Okay.
Yeah, I received. All teams have texted me. Let's start.
Can we start? Is it okay for everyone, or any other queries? Okay. I think we can start. First question.
ஜனனி இன்னும் 6 minutes தான் இருக்கு. ஃபர்ஸ்ட் क्वेश्चन மட்டும் முடிச்சு நெக்ஸ்ட் போய்க்கலாமா?
Okay sir. First question முடிச்சு நெக்ஸ்ட் போய்க்கலாம்.
சார் 2 क्वेश्चन முடிச்சதான் நினைக்கிறேன்.
Maybe ரெண்டு क्वेश्चन முடிச்சிடலாம் சார். 4 minutes. So 4 years old child with a Perinatally acquired HIV infection, presented with fever and a maculopapular rash behind the ear and in the face, and was admitted in the hospital for the treatment. The child developed severe respiratory distress and died 8 days after admission. The postmortem examination of the lung tissue showed multinuclear giant cells with nuclear and cytoplasmic inclusions as shown below. What is the diagnosis and name the cells? So time starts now. Asian pounds also solitaire. Yes, team has pounds.
So second team number 2 has pounced, and it's right. Sir, we need the diagnosis, sir. Praveen, sir.
Team 5 also pounced.
Yeah.
They have also pounced.
Team 4 has
Yes.
pounced.
Team 5 has pounced, and that's right. Team 1 has pounced, it's right.
Right, solla apro solitare pounds.
We have also pounced.
Even team 4 has
Okay.
pounced.
Can you pounce it like team 4, T4, T3 like that? Because I'm not getting like team number. Mysore is which team?
Okay, team 4 is Mysore.
Can you pounce like T4 and then can you answer the question? Because you don't know which team it is. Yeah.
Okay.
So time
But
up,
this one is
actually, no.
considered, right? We have answered.
Yeah, you answered. Okay. Yeah.
So
Time up
anyway,
now.
okay, time up.
So I'm getting like team 1 and team 3 I'm getting in the text. Team 1, team 3, team 5 I'm getting in the textbook itself. For team 2 and team 3 you text as T2, T3, then you text answer. Because I'm
And we've already sent the answer. What do we
yeah. For first question you have sent. Yeah, I've seen it. Okay.
Is this also?
So team 1 answered right, getting plus 30. Team 2, sir, diagnosis wrong, sir. So minus 10, and but you answered the sub question correct. So 0 for team
Plus
2.
10.
Team 3 you answered diagnosis again wrong, but the sub question is right. So team 3 also not getting marks. Team 4 answered it right, and they're getting plus 30. Team 5 answered it right, they're getting plus 30. Sir, AG sir, முடிச்சிக்கலாமா? டைம் இருக்கா?
Answer set போயிடு.
டைம் இன்னும் 2 minutes இருக்குடா.
அப்ப முடிச்சிக்கலாம்.
Answer set போயிடு முடிச்சிக்கலாம்.
No.
So the answer, the diagnosis is H pneumonia, giant cell pneumonia, and then Warthin penicilliasis. The cells are Warthin penicilliasis. Okay, முடிச்சிக்கலாம்ல?
Yes.
So please leave the meeting and rejoin again.
Yeah. MMC
AG sir join பண்ணிட்டீங்களா?
ஒரு நிமிஷம்டா, மத்த ரவுண்ட் பிபிடிஸ் ரெடி பண்றீங்க. 2 minutes.
Okay sir.
screen தெரியுதுல?
yes sir
yes
தெரியுது.
sir, yes sir.
சரி அப்படியே ஹைப்பர் லிங்க் சைடு வந்து பார்ட் 2 போயிடுங்க. First question over, sir. Second, okay. Shall we move on to second question?
Okay. Second question போங்க. என்ன இருக்குங்க? So can we move on to second question? All the teams?
Yeah.
Yes sir. Second question போங்க.
Okay, 10-year-old boy from East Africa who is stunted by growth starts to nod very rapidly in a continuous and pendulous manner upon presentation with food. He also has a subcutaneous nodule on hands which is firm and non-tender. Many such episodes of repeated drooping of head has occurred accompanied by generalized tonic-clonic seizures and cognitive impairment. What is the diagnosis? Which antibody is found in the serum CSF of the patient in above syndrome? You can see the picture. Time starts now.
Team 2 has bounced. Team 3 has bounced. Team 5 has bounced.
25 seconds more. So 10 seconds more. Rest of the team, if you want to bounce, it can.
Team 1, Team 2 didn't bounce.
Scores. Mission scores.
Time up. So Team 2 has bounced it rightly. They are getting plus 30. And Team 3, Team 5, both the teams have bounced the diagnosis wrong. So they're getting minus 10. Team 3,
Team 3 and Team 5, yeah.
Yeah. Okay. Team 3, Team 5 getting minus 10. Team 2 got both the questions right. So they're getting plus 30.
1 and 4, 0.
1 and 4 they didn't bounce.
Okay, fine.
So they're getting 0.
Answers?
The answers like.
So it is nodding syndrome. It is believed to be associated with onchocerciasis, and the antibody is model 1 auto antibodies.
Okay, shall we move on to question 3? Then any timer மட்டும் பாரு.
Okay.
So question 3, a 43-year-old man was first diagnosed with HIV 1 year before the presentation. He had been complained with this antiretroviral therapy. The patient subsequently developed diffuse rash and fever up to 100.6 degree Fahrenheit. Initially, it is thought to be a drug related, but he continued, however, to complain of the fever associated with diffuse myalgia and malaise. On examination, his heart rate was 112 and BP is 99/56. Marked lymphadenopathy was noted in cervical, axillary, and inguinal areas bilaterally. Spleen was palpable. Lab evaluation revealed hematocrit was 21%. HIV viral load of 444 copies per ml. CD4 count of 193 cells per millimeter cube. Notably, the patient's HHV8 titer was more than 10 lakh copies per ml. Lymph node biopsy is shown in the next slide. Sir, next slide, sir. Sir, Reddy, sir, next slide.
The time
So, what's
starts
the
now.
diagnosis and name the sign which is seen here in this biopsy image? So, team 3 has bounced, team 2 has bounced, team 1 also has bounced. Team 5 pounds, team 4 pounds, team 1. So all the teams are pounds.
Time up.
So team 1 got the diagnosis right, and they didn't answer the sub question. So they answered sub question also. So team 1 getting plus 30, team 2 getting plus 30, team 3 answered only the sub question. No, team 3 also getting.
We've answered both.
Yeah, fine. Sorry. Team 3 getting plus 30. Team 4 getting plus 30. Team 5 also plus 30. So every team has answered. So next question. So a 57-year-old man who is a known case of CA colon was receiving a second-line chemotherapy treatment with cetuximab or irinotecan. On 8th day of the second cycle, the patient developed sudden onset of fever, fatigue, and irregular non-tender hemorrhagic macules on the palms. On further evaluation, a new onset systolic murmur was heard. Blood samples were taken and sent for culture and sensitivity. So, what is the most likely organism to be involved in this case, and which group does this organism belong to?
Time started.
Team 3 has pounced. Team 2 has pounced. Team 1 has pounced. Team 3 has pounced.
Five seconds for time up.
So the time is up. Team 1 gets plus 30. Team 1 plus 30. Team 2 gets plus 30. Team 3 answered the sub question wrong. So they are getting plus 10, plus 20 and minus 5. They're getting plus 15. Sorry. Team 3 plus 15. Team 4 has answered it right. So they're getting plus 30. Team 5 also plus 30. Sir, அவ்வளவுதான் sir, sir.
Team 4, team 5.
Round. Yeah, team 4, team 5 both getting plus 30.
So this the end. Marks I will be telling. Check if it's okay. Once I mean if it's right. Team 1 total score. Team part 1 and part 2. Team 1 has scored 85 points. Team 2 120. Team 3 50. Team 4 105 and Team 5 100 points.
Okay. Is it okay with everyone?
Can you also tell the total score?
Yeah, total score only. I mean, okay, for round 1 and round 2.
They're asking like round 1 and round 2. Total score.
Yeah, we'll update the total scores of round 1 and round 2 in the chat box. At the same time, round 3's rules will be discussed now. Is it fine?
Okay.
Hello, am I audible?
Screen visible, la?
Yes, sir.
Yeah.
Okay. So this is round 3 and we didn't name it because we couldn't come up with a name for it. I am Lahiri and me along with Kishore will be conducting this round. We'll go to the rules slide. So this is a case-based round. There'll be totally 5 cases. Each team will be given 1 case. For which we'll read the question first, after which within 1 minute you have to give a specific diagnosis. For the direct team, you'd get a plus 25 for correct answer and no negative if you attempt it wrong. The other teams can pounce, and this should happen within 30 seconds. The pouncing teams, they'll get a plus 25 if they're right and minus 15 if they're wrong. The direct team, after the case, they get 2 sub questions. Total 15 points. There'll be no negatives for the sub questions, but you have to answer it within 45 seconds. The sub questions are not open for pouncing. Any doubt?
Suppose if we don't answer the case, will we
You don't
be
get
eligible
negative.
for? No, will we be eligible for sub question? If we let's say I'm not okay, fine.
Yes.
Could we send our pounds responses?
Kishore, there'll be an account. Kishore, say hi.
It's Kishore Nyaneshwari. You can send it to me.
We can go to hyperlink, sir.
Yeah, so we'll be starting with team 1. Team 1, choose your hyperlinks.
We'll choose Narcos, second one.
So Narcos. Okay, an 80-year-old man with stage G3A chronic kidney disease due to diabetes mellitus was admitted for upper lobe pneumonia. After appropriate investigations, he was managed with IV vancomycin. The patient had a rise in serum creatinine level from 1.4 upon admission to 5.3. An estimated GFR of 9 ml per minute per 1.73 meter square, and purpuric lesions on the bilateral lower extremities. Oral glucocorticoid was initiated for a presumed diagnosis of IgA vasculitis. Next slide. So next slide, please. Next slide.
Yeah, it changed.
Oh, it's not changing for me. Larry, can you just continue the question?
However, the kidney function continued to worsen and oliguria ensued despite the infusion of lactated Ringer's solution. Upon physical examination, he was not in distress. The blood pressure was 110/78 mmHg. There were trace pre-tibial edema and purpuric lesions on the bilateral legs. Urine analysis showed more than 100 red blood cells per high power field, 70% were dysmorphic, and 5.2 gram for 24 hours proteinuria. Immunological analysis showed increased immunoglobulins and decreased complement levels. ANA antibodies, anti-myeloperoxidase antibodies, anti-proteinase 3 antibodies, and a glomerular basement membrane antibody were all negative. Next slide, sir. A renal biopsy was done, histopathological examination, electron microscopy, and next slide, sir. Immunofluorescence are shown. So you get 30 seconds for pouncing and pound starts now. Do you want me to go to any particular slide?
And we are looking at
To
a very
whom do we
basic
have to
diagnosis.
attest the pounds?
Kishore Nyaneshwar. Kishore Nyaneshwar.
Can you show the
And can we show the previous slides? And the previous one. The previous one. And the previous one.
Has anyone pounced?
No, no one has. We're looking at a specific diagnosis.
Okay, you have 15 more seconds to pounce.
Have a good look at the immunofluorescence. Team 3 has pounced.
Anybody who wants to pounce? I guess the direct team can answer.
Is this cryoglobulinemia? Hello.
Hello, are we audible?
Yes,
Yeah,
yes, you
yeah.
are. No, the answer is incorrect. Do you want to go for another attempt?
Post-infectious glomerulonephritis?
No.
Okay.
Okay, so the time is up. So team 3 had pounced and it was incorrect. So they get a negative of -15. And the direct team does not get any mark. Okay. So the answer,
Okay,
say,
sir.
please. Okay, so the answer is IgA dominant staphylococcal associated glomerulonephritis. It is a subset of infection-related glomerulonephritis. While PSGN used to be extremely common, recently this has been seeing an increase. You can suspect it based on the initial infection with the staphylococcus. And while a PSGN usually follows a streptococcal infection, an IgA dominant staph is concurrent with an infection. And with the immunofluorescence, you can see the presence of IgA and C3. This is usually misdiagnosed as an IgA vasculitis, HSP, or something like that, and a presumed diagnosis leads to corticosteroid therapy, which might actually lead to worsening of the infection. So this, the answer is IgA dominant staphylococcal. Sir, sub questions, please. This will be only for team 1. What are the two nephritogenec streptococcal antigens in PSGN? And the second question will be vancomycin resistance in Staphylococcus aureus is usually conferred by the VAN gene, which causes conversion of DALA to pyruvate. What is the mechanism of resistance in vancomycin intermediate staph?
So like
Team 1, you can answer directly.
First question answer is streptolysin and DNase B.
DNA is B. Can you please repeat your answer?
DNase B. DNase.
No. In PSGN, the nephritogenec streptococcal antigen, the two main streptococcal antigens in PSGN.
You have 15 more seconds. Do you want to attempt the second question?
No, we'll pass. I don't know much.
Okay.
Okay. So the answer slide.
Let's go back to hyperlink. Kishore, say answer.
Yeah, the answers are one is nephrin-associated plasmin receptor, which is also known as the glyceraldehyde 3 dehydrogenase, and the other is streptococcal biogenic exotoxin B. And the second one is an increase in the non-cross-linked D-alanine side chains. So what happens is these side chains sequester the vancomycin. So the vancomycin binds to those residues. They cannot enter the cell. This leads to a new different phenomenon called vancomycin intermediate resistance, which is different from vancomycin resistant Staph aureus.
Okay, so team 1 gets no marks. Team 2, please choose your hyperlink.
Stranger Things.
Okay, a 5-year-old male was admitted to hospital with impaired consciousness for 10 to 12 hours. The mother gives a clinical history of the patient developing high-grade fever 4 days ago, following which he developed an altered sensorium. The patient also had abdominal pain and vomiting for the last 4 days. The patient had been given antipyretics and no other treatment was given. On examination, pulse was 110 beats per minute, temperature 102 degree Fahrenheit, blood pressure 150 over 100 mmHg. There was marked pallor. Abdominal examination revealed hepatosplenomegaly. Next slide. Neurological system examination revealed an altered sensorium, brisk deep tendon reflexes, bilateral extensor plantar reflexes. A fundus examination was done following dilation with a midriatic and revealed the following. Next slide, sir. CT brain suggested generalized cerebral edema. Lab investigations revealed a hemoglobin of 8.4 grams per DL, a WBC count of 9,800, and platelets 1.05 lakh per mm cube. CSF examination was normal. What is the most probable diagnosis? You can pounce.
So we should only answer after they pounce.
Yes, sir.
Yes, sir.
Okay.
Please
Can you
have a
just
look
go back
at
to the history once?
Who should we message this to?
Kishore
Who should we message?
Kishore Nyaneshwar.
Can you go back to the history once?
Team 3 has pounced. Mysore has pounced. Team 4.
20 more seconds.
Can you show the fundus again?
And Mysore team 4 have pounced.
Last 5 seconds if anyone wants to pounce. Team 2 can answer now.
This is a case of cerebral malaria. Hello?
Yes, sir.
Cerebral
Yes, right?
diagnosis cerebral malaria.
Yeah. Answer slide, please. Yeah, it is cerebral malaria with malarial retinopathy. We'll go to sub-questions now.
Team, just a second. Team 3, team 4, both of them got the bounce, right? So they get plus 25. And the direct team also get a plus 25. Okay.
Sub-questions, please. The life-saving benefit of artesunate over quinine in severe malaria results largely from the additional killing of which forms? Okay,
Gametocidal.
It's not right. Second sub-question, to prevent relapse, primaquine is used in a dose of 0.25 mg per kg for 14 days. WHO provides a conditional recommendation that primaquine may be considered at a dose, frequency and duration of what in G6PD deficient patients?
You want dose, frequency and duration all?
Yes, sir.
Yes, sir.
Dose is 0.75 mg per kg.
Yes, sir.
Triad. One day.
Just one dose, one day. Is it
One
what
dose,
you're
one
saying?
day. Yeah. That's what I told. No.
Sir, how many times do you want to give it?
One dose, one day. What? Just stat 0.75 mg per kg stat.
So we're talking about we're talking about Vivax and Ovel. In a G6PD patient, 0.75 milligram per kg for how many days? How many times will you give it?
Dose correct.
Talking about Vivax and Ovel. Yeah, 0.75 milligram per kg is correct. It is normally given at 0.25 milligram per kg for 14 days. In G6PD, how much? Where will you give it? How much?
One dose. ஒரு நிமிஷம் இரு. என்னது? Single dose. Single dose. One day.
Okay, it is given weekly for 8 weeks. So
So the answer.
How many marks do they get?
The first, it is because of its action towards the ring forms, which is the immature trophocytes, which is not possessed, which is not killed by quinine, whereas artesunate acts on it. The second is 0.75 milligram per kg, weekly one dose for 8 weeks. This is a WHO conditional recommendation. They do not get any points for this. Okay, 0.75 milligram per kg was right. So 7.5 plus 7.5, we can give 5 points.
So team 2 gets a total of 30 marks. Question.
Is that okay with the scoring team?
The question asks the dose, frequency, and duration. So if they had answered that entire part correct, perhaps then it would have been justified. But they erroneously said one dose, one day. Oh.
Okay, it was a total of 7.5. That's a question.
There is part marking in all.
Yeah.
In that sub
All teams there'll be part marking.
Okay.
For the sub question.
Okay, how much time do we have left in this meeting?
We have time.
Okay, team 3, choose your hyperlink.
We'll choose Mindhunter.
So Mindhunter. A 60-year-old woman presents with mildly painful, irregular, dusky erythematous plaques on her buttocks, thighs, and legs, and swelling of hands and feet since 3 days. It was associated with mild fever and malaise. There were multiple skin lesions as shown below on bilateral buttocks, legs, and ear helices, associated with edema of distal extremities. Her facial appearance is shown below. So next slide. So next slide. Yeah, so these are the images. You can have a look at it. Next slide, sir. The examination additionally revealed symmetric hypoesthesia on bilateral distal extremities, atrophic scars on the lateral and dorsal aspects of fingers, thick bilateral ulnar and common peroneal nerves. Motor examination and cranial nerve examination results were within normal limits. There was no evidence of neuritis. Routine investigations were within normal limits except for elevated ESR. Investigations to look for an underlying coagulopathy and connective tissue disease, including ANA, prothrombin or INR, activated partial thromboplastin time, and lupus anticoagulant were within normal limits. So next slide. Histopathology from the center and margin of the necrotic plaque revealed the following. You can see the image. Microbiological investigation undertaken for the most likely diagnosis returned positive. Diagnose. So time for bouncing starts. Do you want to visit any particular slide?
What could you please?
Do you want to visit any particular slide?
No. We'll answer at the end of our.
Okay, team 1 has bounced. Mysore team has pounced.
15 more seconds to pounce.
MMC team 2 has pounced.
Last 5 seconds. The direct team can answer. What?
Diffuse leprosy of Lucio.
Do you want to add to that? Yes, the underlying condition is diffuse leprosy. Has there been anything adding to it for the presentation currently?
Lucio phenomena.
Yes, that is right. So the direct team gets it right. It is the Lucio phenomenon seen in diffuse leprosy of Lucio and Latapi, also known as leprosy bonetta, because it's called the beautiful leprosy. The teams that get the point are team 1 has pounced it right. Mysore team has pounced it right. Team 2 has pounced it right. And the direct team. So all of them get plus 25. Is that all right? Can we move to the sub question? Okay, so calculate the WH leprosy disability score. We've given the parameters here. You can calculate it. We'll just have a look at the second sub question. So next slide. Identify this. So you can visit whatever slide you want.
You have to identify the instrument or
the test, basically.
The instrument, okay. One phrase aesthesiometer.
No. You want to calculate the disability score?
Yeah, just show that one.
Previously. Just for clarification, the right eye 6/36 is after leprosy had occurred. Initially, it was normal 6/6.
Ten more seconds. Time is up.
9.
No, that is incorrect. So the disability score would be 10 in total. It is 1 for the right eye because the vision has been reduced, but it is more than 6/60. 2 for the left eye because even though the vision is 6/60, lag of ophthalmos is present. And then the right hand would have 1, left hand would have a 2, right foot 2, left foot 2. So a total of 10. And the second one is semi-Sweinstein monofilament test. So they do not get any mark for this sub-question.
Team 4, please choose your hyperlink.
Can you give me 30 seconds? One of my teammate got disconnected. 30 seconds.
We'll give you 4 minutes. We'll come in the next meeting.
Okay. I don't.
Okay, so the next meeting, right?
Can we choose?
Just before that, just 1 second. In the previous question, for the first subdivision, there is a change in the answer. A total of 9 would be correct because the right hand, I had given that sensation, a touch can be perceived. I think there was an error in that. So it would have a score of 0, giving a total of 9. So the team gets 7.5. That was team 3, I assume.
Yes.
Yes. Team 3 gets
So
7.
for the previous question, team 1, 2, 4 and 5 have answered the diagnosis right. Am I correct? You sure?
Just a sec. The chat is gone, so.
Teams, can you confirm once?
Yeah, we have answered.
I think you called out the pounds for only 3 teams.
1, 2 and 5 have pounced and got it right.
That's fine.
Even 4 got it right, I guess.
Yeah, it was your direct question, right?
No, it was direct for 3.
Okay, sorry.
Team 5
Team 2, did
bounced
you
to that
bounce?
question.
Yeah, we had answered.
Team 5 hadn't bounced for this.
Yeah, it's 1, 2 and 4. 1, 2 and 4 had a
Okay.
bounce and they get plus 25. Since it was the direct question for team 3, they got the diagnosis right, it was plus 25. And for the sub question, they get 7.5. Are we clear?
So team 1, 2 and 4 get plus 25. Team 3 gets plus 32.5. Team 5, 0. Scoring team, is it fine? Can we move on?
Yeah.
Yes.
Okay, team 4, are you ready to choose your hyperlink?
Yes. Chernobyl.
Okay, a 13-year-old girl presented in medical outpatient department with complaints of progressive deterioration in cognitive function like poor scholastic performance and difficulty in understanding and carrying out specific tasks. The cognitive decline was rapid over the past few months. There was also a history of involuntary movements in the form of jerks, which made it difficult to maintain her equilibrium while standing or sitting upright for a few seconds. There was no history of seizures or visual, hearing, or sphincter disturbances. Next slide, sir. History of any childhood illness was unknown, and the child was unvaccinated. On examination, she had persistent negative myoclonus in the form. Is there any issue? On examination, she had a
mute yourself. MMC Tech, can you mute yourself?
On examination, she had persistent negative myoclonus in the form of shock-like involuntary movement involving the trunk and lower limb muscles every few seconds. IQ testing was done and showed moderate mental retardation. Brain MRI revealed high intensity in the gray matter and subcortical white matter in the parietal region. Next slide, please. EEG is given below. CSF examination revealed elevated globulin levels, and the IgG against the likely pathogen was elevated. What is the most probable diagnosis?
The pounds time starts now. It's for the next 30 seconds. You can send it to Kishore and Anushka. Team 5 has pounced. Team 1 has pounced. Team 2 has pounced. Okay, pounce is closing. Team 3 has pounced. Okay, bounce closes. The direct team.
Is it SSP?
Yeah, you're right. So, Kishore, say the marks once.
Yes, team 5, team 1, team 2, and team 3. All of them get it right. So they get plus 25. And the direct question is to team 4, and they also get it right. So plus 25. So all teams get plus 25.
We'll move on to the sub questions. First one, there is no cure for SSP, but an estimated 30 to 35% of the patients have improved or stabilized after one or several 6-week treatments with intraventricular interferon alpha combined with X. X has been proven to positively impact the host's immune system by enhancing T cell lymphocyte proliferation and activity of natural killer cells, increasing the levels of pro-inflammatory cytokines. Identify X.
Have a look at the
Next sub question. Name the complexes found in EEG of an SSP patient as shown below.
There is a Reddy complex.
Okay, first sub question, do you want to answer?
Can you put the? We have a negative, right? If you get it incorrect.
No, that's not negative.
Is it ribavirin?
No, it's the wrong answer. So team 4 gets plus 7.5 for the sub questions. The answer is isoprenos.
We have a small clarification. Team 3 had pounced it as PSPE rubella. That would be incorrect. So the plus 25, so the plus 25 that they get is gone, and instead they get a negative of 15. Scoring team for team 3, you remove the plus 25 and give them a minus 15.
So the score for fourth question would be team 1 plus 25, team 2 plus 25, team 3 minus 15, team 4 32, team 5 plus 25.
We will go with Sherlock Holmes.
Going with?
Sherlock.
A 6-year-old boy presented to the emergency department with severe throat pain and a raging fever for 1 day. The patient was unable to eat solid foods because of pain. On physical examination, cervical node lymphadenopathy, a swollen uvula. Is there any problem? And palatal petechia were noted. A throat swab was taken. Lab investigations were done, and he was treated with IV penicillin and topical analgesics. So next one. 2 weeks later, he presented with an acute onset of small red scaly papules and plaques on his trunk and extremities. The lesions are not itchy, and some have a fine scale. Parents deny any history of skin conditions in the past. Physical examination reveals multiple 1 to 10 millimeter teardrop shaped salmon pink papules with a silvery scale. You can see the image here. Next slide. There are no other significant findings on the skin examination. The patient was otherwise healthy. Skin biopsy was taken, which has been shown below. Diagnose. Your time for pound starts now. You can send it to me. If there is any slide you want to look at. Team 1 has bounced. Team 4 has bounced. Team 2 has bounced. Okay, they're closing pounds. The direct team.
Yes, so the diagnosis is gutted psoriasis secondary to streptococcal infection.
Yes, that's perfectly right. So the answer is gutted psoriasis. So the teams that get it right are team 1, team 2, and then team 5. They all get plus 25. Team 4 gets minus 15. I repeat, team 1, team 2, team 5 get plus 25. Team 4 gets minus 15. Moving on to the sub questions. Identify X and Y over here. Next slide. Identify the typical signs seen in echocardiography seen in the advanced cases of chronic rheumatic heart disease.
So can we go to the previous question? Its answer is 10 and 40 years.
Yes, that's right. You get 7.5
Respectively,
for that.
excellent. Yeah, and second question?
You have 20 more seconds to answer.
Mitral stenosis.
We need the typical sign.
Fish mouth.
No.
I guess time is up.
Yeah, the time is up. So the first subdivision was right. It is 10 and 40. And the second subdivision, it is the dogleg sign or elbow sign or hockey stick sign. So for this question, team 5 gets 25 for the direct for the diagnosis and 7.5 for the sub question. So it's a total of 32.5.
So for the fifth question, team 1 gets plus 25, team 2 plus 25, team 3 0, team 4 minus 15, and team 5 plus 32.5. The scoring team, is everything fine? Any confusions? If there are no issues, we can conclude this round.
Am I audible?
Yes, sir, you're audible.
Yeah, so I request all the 5 teams to have their videos on. And so this round is exclusive policy based round. So let's move to the rules page. The next page. So yeah, there are totally 6 questions in this. 5 plus a bonus question in end that will be open for all the teams. Yeah.
1 second. My teammate just disconnected. Just a second.
Yeah, okay, sir. We'll wait.
It shows she's in waiting. Host has to allow her.
Yeah, we'll wait, sir.
It says he's in the waiting room with Reddy.
So the scores at the end of third round will be announced now. So we'll continue this round and scores will be announced at the end of fourth round. So as the third participant joined. Praveen, sir?
1 second.
Okay, fine. So we will continue that. So I'll just explain the rules first. Okay, so there are totally 6 questions, one for each team, and then a 5 bonus question that can be answered by all the teams. So there are totally 6 hyperlinks from which you can choose, and each question has 2 subdivisions, and both subdivisions carry 10 points each. And each team will be given 1.5 minutes to answer both the subdivisions. If the direct team fails to answer, the question will be available for open bounce, and the time limit to submit the answers is 30 seconds. And the marking scheme for pounds is plus and minus 5. That is, if you answer it right, you'll get plus 5, and if you answer it wrong, minus 5 for each subdivision. So let's proceed. So next page. Any doubts with the rules?
Whom should we pounce?
Yeah, you can just send it to the name as Varun K. Sami. That is, yeah.
Okay.
Hello?
Just a second. Can you repeat it just once again? Can you just go back to the rules, like?
Yeah, sir, previous page, please.
Okay, so only if they fail to answer, it's open for bounce.
Yeah, yes, sir.
And if they don't give any answer, do they have any negative?
No. The direct teams never have a negative. The teams which pounce will have minus 5 for each subdivision and plus 5 for each subdivision.
Okay, fine.
Yeah. Any other doubts regarding the rules? So yeah, let's proceed. Okay, team 1 choose.
Second image in the second row.
Second one.
Just to in pounds. In pounds, who should we send the answers to?
Yeah, to Varun K. Sami. You will have the participant as Varun K. Sami. Just send it to that. Sir, this second row, second one, sir.
Okay.
Yes, Bansal.
So yeah, we have a question here. A 67-year-old Caucasian man with type diabetes, presenting to the OP with cognitive deterioration and steady gait. And a key point here is he has been visiting Western Africa, that is Ghana here. The coma score, Glasgow coma score is of around 7 to 14, and he's unsteady in his gait. On seeing the clinical features, we can come to an conclusion that he is having late phase of West African trypanosomiasis. Now, what I want is the drug of choice for the condition, that is the late phase of West African trypanosomiasis, and the drug used in the early phase of the West African trypanosomiasis, and its one use. Directing team 1. Am I audible?
The first answer is melasoprolol.
For the drug of choice for the late phase of West African trypanosomiasis?
Yes.
No, it's not. The second one, you want to write? Early phase of West African trypanosomiasis? Okay. Can you tell any other use other than the early phase?
Is leishmaniasis you can use. It is one of the drugs in leishmaniasis.
Sorry, can you come again? Sorry, can you come again?
Pentamidine is one of the drugs in leishmaniasis. It is one of the
Okay, fine. Team 1 gets 10 points.
Now will you pounce for the first part?
question. Now the remaining teams can pounce for the first part, and you can pounce the highest. You can pounce the highest. Sorry for the technical difficulty. Sorry. Okay, time up. Team 3. Team 2. Team 5 has got it correct. The answer is affirmative. They get plus 5 marks. And team 1 will get plus 10 marks for answering the second part of the question. I will go back to the hyperlink.
So team 2, you can choose your hyperlink now.
Last one, friends படத்துல வரும்ல சிரிச்சிட்டு இருப்பாங்க அது last one.
Okay, sir. So second rule.
Please, everyone, switch on your video. Team 5, switch on your video, please. Team 5, switch on video. Team 5, please switch on your video. Team 2. Team 2, please switch on your video. Shirish, sir.
Sir, third question. Yeah, so can I get the question or?
Yeah, you can read out within that video.
Yeah, a 27-year-old African lady who was a patient living with HIV and AIDS was admitted with generalized clinical seizures lasting to 5-10 minutes. The seizures were preceded by severe front headaches and reading the occiput and neck and associated with chills, photophobia, and loss of consciousness. She was diabetic and had tongue bites on the left side down. Kernick's and Babinski's signs were positive. India Inc. was positive on 2 cerebrospinal fluid samples. She is non-compliant to ARTs. So the diagnosis is chronic meningitis. I wanted to comment on its management basically. So yeah, so
you like
so no sir, because it's just I don't need the identity like the disease. So basically,
okay, it has 2 phases. First, induction phase, continuous phase.
Yes, sir. Yes, sir.
And since this phase are already having AIDS, we have to treat the OI first.
Okay.
So based on the management, first you should see CD4 count. It should be if it is low but above 50, then we have to start the treatment for Cryptococcus first. That's amphotericin B with flucytosine and regimen.
Yes, sir.
That is followed by the maintenance regimen with the fluconazole.
Okay, so
that is A answer.
Yes, sir. So what is the answer for B part? So the second part?
B answer, marker of toxicity means you want its what enzyme it produces.
No, sir. I need the serum marker for its toxicity.
Oh, CRAG.
So can you abbreviate it, please?
Cryptococcal antigen, CRAG, lateral flow assay we will do.
I was not expecting for that answer. Any other answer, sir?
இல்ல marker of toxicity கேக்குறாங்க.
Sir, marker of amphotericin B toxicity, sir.
Amphotericin B toxicity யா?
Yeah.
அப்ப வந்து hypokalemia, hypomagnesemia இருக்கும்.
Yes, so what is the serum marker that will be Yeah, I'll give plus 10 for the first part. So the B part would be open for pounds now. So you can message Harish. You will be given 30 seconds for pounds.
You want only the schedule or the name also?
So schedule is enough.
Okay.
Okay. Team 2 has pounced and they get it right. So plus 5 for team 2 and plus 10 for team 3 for the direct question. So the name of the vaccine is Biothrax. So that's it. Like, yeah, you'll go to the hyperlink page.
The fourth one.
Okay, so here we have a 16-year-old teenager coming from a low socioeconomic status, and more important point here is he is an opioid drug addict for the past 2 years, and he is under rehabilitation facility and he is under treatment for the withdrawal symptoms. During the treatment, he got HIV somehow, but now what I want here is what is the drug regimen which is given to treat the HIV for an adolescent male, and there is a glitch in the treatment given to this male, and because of that, he had withdrawal symptoms. That is, he got craving after taking the HIV regimen. That is, he got craving for the opioid even under the opioid withdrawal treatment after taking HIV regimens.
Can you repeat what you said?
Like, see, he was an opioid addict. He was under treatment. He was under rehabilitation. He was receiving drugs for the controlling the withdrawal symptoms, and he got HIV. Now, the first part of the question is you have to tell the HIV drug regimen for an adolescent male. Second part is now you see this guy was an opioid addict and he was receiving treatment. But after taking HIV regimen, he again got cravings for opioid. Do you understand? After taking HIV regimen, he got cravings for the opioid. That is something to do with the regimen and the withdrawal symptoms. That's what I want. You can also try to answer the first question. What's a drug regimen for an adolescent teenager for HIV?
Hello.
Yeah.
Yeah, we can answer the first one.
Yeah, sure.
The first one you're asking just the drug regimen that is generally given, right?
For
or
an
you're asking for this
adolescent.
patient?
Okay, you can give for the general also for this patient also. I'm happy with both the answers.
Usually we give 2 NRTIs with one NNRTI or a protease inhibitor.
Name, please.
Is it yeah, tenofovir with the Mahima,
please answer one at a time.
Hello.
Hello.
Yeah, tenofovir, efavirenz, and emtricitabine.
Okay, fine. The first part is correct, and do you know the answer for the second part? Like there has been a change. You see, you said tenofovir, efavirenz, and emtricitabine, right? These three drugs, there is something between these three drugs and the opioid craving. Can we link this both? Okay. Time up.
Protease inhibition. I mean, this one, cytochrome.
No, direct team, please stop it. The time is over. Other teams can pounce. Okay, time up for pounds. Team 2 has got it right. Efavirenz induces the metabolism of methadone, which is taken for opioid withdrawal. Hence, he got cravings again. And this is due to the enzyme induction of CYP3A4. T2 gets plus 5 points.
We get plus 10 for this.
We can go to the hyperlink page, sir. Team 5, choose your hyperlink, please.
Varun, there is only 1 minute left.
Yeah, sure, sir. So can we just disconnect and connect in the next link, or what can we do now, sir?
I will just disconnect and go for the next.
Yeah, sure, sir.
Bindas now.
Hello, can we choose?
Wait a second. Has everyone joined the meeting? Has everyone joined the meeting?
1 second. My teammate is yet to join.
Has everyone joined this meet? Athikins, can we continue or?
யாடா நீ கண்டினியூ பண்ணு. Whose question is this?
Team 5.
Team 5, yeah. As long as all 3 members of your
Team
team are
5,
here.
you can choose your link.
Which ones are remaining? Hello.
The hyperlinks 2 and 3 are the available hyperlinks now.
Link 3.
Okay, so here we have an 45-year-old farmer with painless swelling in the right groin. And then he noticed many itching and rashes. And that is a characteristic hanging growing sign. Multiple pigmented macules depicting the leopard skin. And ocular examination revealed he had conjunctivitis and punctuate keratitis. We have an onchocerca infection with characteristic ocular and cutaneous manifestation. Now, what I want here is the drug of choice for onchocerca and what will happen if you give the drug of choice if for an coexistent filariasis infection. If you give the same drug, if there is a coexistent filariasis infection. Team 5, you want to answer?
Yeah. Team 5. So answer 1 is ivermectin.
Okay. And
second option, Maserati reaction.
yeah, correct. Can you elaborate what happens in Masudi reaction?
It's a hypersensitivity reaction when filariasis, like an existing filariasis, it's given.
Yeah, fine.
Because it acts as an antigen.
Okay, fine. Team 5 gets plus 20 points as they have answered both the questions. The questions equal or not for points. Sir, we can move out to hyperlink. So now we have only the second part of the hyperlink alone remaining. This hyperlink will be a bonus question. All the teams it will be available for open pounds and each question carries 10 marks. There is no negative marking.
What is the time limit?
The time limit is 1 minute 30 seconds.
Excuse me, like,
just as
we
they
got
like
disconnected
the
in the
directing.
call, so can you please wait for 2 minutes?
What happened, sir?
We got disconnected on the call, so can you just wait for 2 minutes?
Okay, sir. Okay.
We need to send the message to Harish, right?
Yes, to me.
Hello.
To Harish.
Okay.
Yeah, you need to send the message privately to Harish. Team 5, have they joined? Hello, Team 5?
We got connected, yeah.
They joined, right?
Oh, wait a sec.
Hello? Okay.
Yeah, we are connected. Ready.
Sir, you can
ready?
open the second link.
We are ready.
Okay. So all the participants are available from team 5.
Yes.
Yeah, so yep. Please turn on your videos. So yeah, in this question, so a woman, after having an unprotected sexual intercourse, she visits her general practitioner for vaginal discharge. So the partner also had urethritis symptoms. Women was screened for Neisseria gonorrhoeae with a nucleic acid amplification test and culture, and both were positive. And the patient was negative for all the other STIs like HIV, hepatitis B, hepatitis C virus infections, and even syphilis was negative. She was empirically started with it. The symptoms were resolved. After 6 weeks, the women returned with vaginal discharge after having another sexual intercourse. So the NAT and the culture of vaginal swabs were again positive for Neisseria gonorrhoeae. Antimicrobial susceptibility testing was performed on the vaginal sample. No empirical therapy was given before antimicrobial susceptibility tests were out. The results revealed that the organism was resistant to ceftriaxone and azithromycin. So the physician termed this case as extensive drug-resistant gonorrhea or super gonorrhea and started the patient on regimen Y. So as well as Y here. Time has started. Can you mention the dose, please, for this question? Those who have pounds for the first part, do add the dosage for the drugs that you have mentioned, please. The pounds is closed. Give us a minute, just calculating this. So 3 teams have pounds, team 1 and team 3 and team 2. Team 5 has given an answer, but that is without dose as well as the regimen is not complete, so we aren't considering that. Team 2 and 3 gets plus 20 and team 1 gets plus 15.
Why, like, what is the wrong thing in our answer?
Because you've just mentioned 500 milligram for ceftriaxone. It's given a dose of 250 milligram. If it's cefixime, it's 400 milligram. So we accept both, but you have mentioned ceftriaxone and 500 milligrams. So yeah. So I am repeating the scores for the pounds. Team 3 and team 2 gets plus 20 and team 1 gets plus 15 here. Any discrepancies in the score? So if there is no discrepancies, we'll move ahead to the scoreboard now at the end of fourth round.
Varun, can you repeat the score for the last question?
You are team 2, right?
No, the entire scores.
Okay, yeah. So the last round, the last question gets the team 3 and team 2 gets plus 20, sir.
Excuse me. Hello.
Yeah.
This is team 1. Actually, ceftriaxone 500 milligrams is there in the CDC guidelines. Could you just cross check and let me know?
Yeah, we'll get back to you. So before the rounds end, we'll just get back to you. Okay, is that fine?
Okay. Can you tell the answer X and Y for the last question?
Yeah. So the answer for the first part is azithromycin 1 gram and ceftriaxone or cefixime. If it is ceftriaxone, 250 milligram IM, and if it is cefixime, we expect 400 milligram. And the second part is pectinomycin.
Varun, 1 minute.
Any doubts?
So, Varun.
Yeah.
For the HIV regimen
Yeah.
adolescents, the team gave the answers tenofovir, emtricitabine, then third one என்ன சொன்னாங்க? What they
Just give me a minute.
Yeah, hello. For the HIV regimen, they told the regimen as tenofovir, emtricitabine, and efavirenz. But lately, efavirenz is replaced with dolutegravir. But what happened in the question is the doctor who wasn't in charge. He gave the old regimen. That's why he got the cravings again. I specifically mentioned that you can either tell the new regimen, I'm okay with it, or the old regimen. That was actually the main question. Yeah. The doubt?
did they tell? efavirenz சொன்னாங்களா?
Yes, they told efavirenz.
Okay.
So we'll go to the scoreboard.
So there's one more round remaining, huh?
There are 2 more rounds.
There are 2 more rounds, ma'am.
Can all the teams see the scoreboard? Can one person from each team respond, please?
Scores of this round haven't been updated, huh?
Scores up to round 4 have been updated.
Okay. Fine.
Are all the teams happy with the scores? Team 1?
Yeah,
Is there any discrepancies?
Oh, no, it's okay. Thank you.
Team 2?
Okay, done.
Team 3?
It's fine.
Team 4?
Yeah, it's right.
Team 5?
Yeah, right.
Okay, we'll proceed with the next round.
Should we change the meeting?
Um, Good evening, everyone. I'm Roshan. Can we proceed for the next round? Can I get a yes from the teams?
Yes,
Am I
sir,
audible?
could you please make it quick also?
Yes. This round will be very quick. This is a very brief round. So I'm audible, right? Shall I start?
Please.
Okay. Okay, the rules of the game is very simple. There's going to be 10 questions. Each question will have a very short history and 3 sub questions. Of the 3 sub questions, I'll give you the timeline now itself. I'll read the question as soon as possible and then the sub questions will be displayed. When the sub questions are displayed, only the one sub question is up for pounds. I will wait 45 seconds for the as a pounds window for other teams to pounds other than the direct team. That pounds question is worth 10 points, and if it's wrong, it's minus 10. The other 2 questions, which are the non-pounds question, will be after the pounds window is over. The question will be directed to the to, let's say, if it's the first team, to the first team. They just have to answer their own question in 60 seconds. Is that clear? So pounds window is 45 seconds. After that, within 60 seconds, they have to give me an answer for all 3 questions. At the end of the 60 seconds, I will move on to the next question. Is that clear? Can I just get a yes?
1 second, doubter. So there are 10 questions. Each question will have small history and 3 sub questions. And the small history and the diagnosis or answer only the direct team will give.
Diagnosis will be so obvious. I don't even want the diagnosis. Sub questions.
You don't want. You want only sub question.
Yes, sir. I only want sub questions, sir. Adula vandu 2 questions is for the direct team. Star put a question. There'll be one question with a star. That is the pounds question. I only want the pounds question. No, before continuing, there's one thing which the organizers want to announce. So yeah, we verified, and team 1 will get 20 points instead of 15 for that ceftriaxone 500 milligram. So basically, the issue was the 500 milligram is given once in 2 days. So, but still we accept it. So you'll get 20 marks.
Okay, thank you.
Yeah. Okay, so we'll continue with the round number 5. Team number 1, please choose a hyperlink.
The first one.
Bugs Bunny. The first one. A 21-year-old male presented with a casualty with fever, severe headache, and vomiting since morning. He was suspected to have meningitis. He had diffuse purpura over the trunk. There was no focal neurological deficit. Kernig-Edbunsinski sign were positive. A lumbar puncture was done, and it showed, and the opening pressure cells and cloudy CSF values are given. The gram stain was a gram-negative cocci. Now the questions which I want the answer for are: what is the role of skin biopsy, empirical antibiotics of choice, with dose, and how long will you treat this patient? Give me based on the organism. And the pounds question is: what is the schedule for the quadrivalent conjugate vaccine with the strains which it covers? The 45 seconds for pounds has started. You're supposed to send the answer to private chat Roshan.
If we know only one part of the answer, will we
No
get
sir,
negative?
no sir, full answer sir, full answer sir. If it's fully should be correct plus 10 or else pounds should be minus 10. No negatives for the direct team. .45 seconds is over. No team has bounced. Can the first team start your answer? You have 60 seconds to complete your answer.
For the third, it is A, C, W, and Y quadrivalent vaccine. 2 doses, 8 weeks apart.
Okay,
Meningococcal
okay, close enough then.
Empirical antibiotics is vancomycin, ceftriaxone, and ampicillin.
You want to give ampicillin for a 21-year-old?
No, it won't listed anything.
You have to give it to me with the dose. Ceftriaxone, vancomycin, I accept. How long will you treat this patient? The organism is given. How long will you treat this patient is also important.
14 days. We'll treat it for 14 days.
14 days is for a general meningitis. Dude, it's a gram-negative meningococcus. For meningococcus, it is 1 week. That's enough. Empirical antibiotics, since you told ceftriaxone, vancomycin, I'll consider part marks. You have a few more seconds. Do you want to talk about the role of skin biopsy?
To know the exact nature of the purpuric lesion, DIC, it can be due to DIC.
What will you see on skin biopsy? That's all. I don't want all of that. What will you see? Can you do it? Is it worth doing it?
Well, it won't give the specific diagnosis either.
It is the in the level of the dermis you can see the organism. You have answered ceftriaxone, vancomycin, and it's ACYW135. W itself is a big zero group. So, but still, and the vaccine is a single dose. The vaccine is a single dose and it should be recorded every 5 months. You are telling the dose for a less than 2-year-old, but I will still consider it for part marks. Is that fine? So I'll give you part marks for second and third question.
Okay. Fine.
Okay. So team number 1 alone gets 2.5 for second question and 5 marks for the third question. Can we go to the team number 2, please use your hyperlink.
Tweety
bird. A 45-year-old female presented with low-grade fever, breathlessness. There was present of splinter hemorrhages, early diastolic murmur in aortic area. Urine examination showed microscopic hematuria. Echo completed the diagnosis. I guess the diagnosis is very simple. My questions are: what is the preferred antibiotic regimen for this patient? When can you reject an infective endocarditis as a diagnosis? And the Pounds question is urgent indications for surgical management. The 45 seconds for Pounds starts now. Urgent indication, at least you have to give me one proper urgent indication.
Can you go to the previous slide?
Previous slide. Now the Pounds 45 seconds is over. Now for the direct team, please go ahead and answer.
Yeah. First, infective endocarditis empirical regimen. Ampicillin plus gentamicin for 4 to 6 weeks because it's a native valve.
Native valve 4 weeks, sir. Okay, next.
And then first third sollidrana.
Please.
Urgent surgical intervention perivalvular abscess.
Okay.
Apro fungal endocarditis.
Fungal elective, sir.
Perivalvular abscess
Large
Okay.
large vegetations.
Okay, accepted. Now can you answer the second question?
Rejecting
First
is if there is some other diagnosis confirmed, or within 4 days of treatment, if there is resolution.
exactly after giving antibiotics, it should for 4 days it should resolve, or an alternative diagnosis should be made. First is right, second is right, third I'll give it to you. So it's 5, 5 and 10 for team number 2. And coming to the pounds, team number 3, you've given me an answer as heart valves. Team and Mysore Medical College, you've given me fungal. I can't give for both. Team 3 again, you give me prosthetic. What is prosthetic and what is heart valves?
Also given team 4 has given that ring abscess near the valves.
Okay, then ignore team 4, we can give 10 points. Team 1, we can give 10 points. Team 3, I don't understand. You've written prosthetic heart valves.
Yes, so if there has been a valvular replacement recently and that has gotten
A prosthetic paravalvular regurgitation, only if it is severe enough, is the emergent indication or an elective indication. Mottaya prosthetic heart valves means nothing. I will not give you negatives for this, that's all. Team 3, 0. Can we go to the hyperlink? Team number 3, please choose the hyperlink.
Third lady. The second. The second one. Orange week.
The second one. A 55-year-old male presented to the casualty with fever, breathlessness, cough with expectoration. A known case of hypertension. His vitals are given. GCS is near normal. Presence of bronchial breath sounds and fine inspiratory crackles. Sputum and blood cultures have been sent. Blood urea nitrogen is 10 milligrams per deciliter. Serum creatinine is 0.8 milligrams per deciliter. This is the chest X-ray. I think this is very clear. Question, please. Now, what is the criteria for sputum adequacy? Now, the second question is the Pounds question, whether we should admit or not. Third, what is the antibiotic regimen of choice and duration of treatment? The Pounds starts now. Do you want me to go to the previous slide?
Show the questions again.
First slide. The details for the Pounds question is given. Whatever details you need for the Pounds question is there on this slide. Your 45 seconds starts now. Preferably, it will be better if you give me the curve 65 score also. That will be better. "45 seconds is over. Only team 5 has bounced. Can we go to the question slide? Team 3, can you give me a...
Can you just show the question again?
I bounced.
Okay, team 2, fine. Team 3, do you want to go with your... Do you want to go to the first slide to discuss the answer? First slide, please. You have 60 seconds. Please give me your answer.
ब्लड यूरिया हो गया,
ब्लड यूरिया रेस्पिरेटरी रेट हो गया,
क्रिएटिनिन हो गया,
बी से क्या था,
क्रिएटिनिन भी तो होता है, ब्रोंकियल ब्रेथ साउंड, बीपी होता है, बीपी
हाँ
बीपी 140 पे
तो 0 हो गया ना, 90 में 2 है स्कोर, आईवी एडमिशन देंगे।
हाँ तो फिर उसमें आईसीयू में डालेंगे।
हाँ आईसीयू में डालेंगे।
आईपीडी आईसीयू, बट हमारा इंडिया वाले में तो उसी में आएगा।
Team 3, can you start giving your answer?
So, questions. So, the modified Bartlett criteria for sputum adequacy.
Yeah, give me what is the criteria? What is the neutrophil count? What is the epithelial cell count?
Less than less than 10 epithelial cells per high power field and more than
Excellent. How
15
much neutrophil should be there? Please be fast. Your time is running out.
more than
Or else you
15.
can answer the other questions. You have only 30
So
seconds.
we
left.
should
Please
admit,
answer.
as per the curve 65, we should admit them in the ICU.
Top 65 is
Third question. Do you want to answer the third question?
So IV vancomycin, sorry, levofloxacin or doxycycline.
IV antibiotic.
IV levofloxacin and doxycycline.
Okay.
Macrolide
Criteria for sputum. The neutrophil is 25. Should be more than 25. Fine. You gave me the name and you gave me a close enough. The first question I accept.
We thought we were asking the criteria. What
I actually I told you then to complete the answer, right? It's okay, fine, it's fine. I'm still giving you +5 for that. Whether we should admit, what was your curve 65 score? Firstly.
2.
I don't
65
65 is it? No, 55. 1.
He is neither confused. His blood pressure is 140/90, does not meet the BP criteria.
1.
Blood urea nitrogen is 10 milligrams per deciliter, not millimoles. You have to multiply that 7 with 6. So cutoff is 42. Neither is there blood urea nitrogen.
Respiratory rate.
Yeah, but you told me ICU. Respiratory rate is the only thing that is satisfied. Do you understand? Only respiratory rate is satisfied. So I cannot give you marks for the ICU. If you are given me, I can't give you marks for the ICU. And antibiotics. And I'll be very quick. Antibiotics IV levofloxacin. Be practical. Have you seen anyone getting IV levofloxacin and doxycycline?
Amoxiclav.
You should have told oral. This is an admitted. I was expecting a simple amoxiclav. A simple amoxiclav would have been enough. But since you gave me doxy, I'll give you part marks. Fine. Even levofloxacin you can give. I'll give you this 10 and 5. I'll give you +10 and +5 for team 3. And for team 2 has answered correctly. Curve 65 only 1, so +10. Team 5 has given ICU, so -10 for them. Can we go to the can we go to the? Can you guys leave this meeting and come in the other meeting? Have all the teams logged in? Can I get a confirmation from all the teams that they've logged in?
Yes, sir.
Which team? Can someone from each team confirm that their team, all 3 team members are present? Okay, team 2 then.
Team 1, could you just wait for 2 minutes?
Fine.
Roshan, can you please repeat the scores for this question?
So scores for the third question. Okay, the scores for the third question. Team 2 gets plus 10, Team 3 gets plus 15, and Team 5 gets minus 10. Have all the teams logged in? Can we continue? So can we start? Can we get the confirmation?
Yes, yes.
Hello?
Yeah, you can start.
Do we have to send the answers?
You have to again to the Roshan private chat. You have to give your pounds answers. Okay. So team 4, please use your hyperlink.
What are remaining?
Daffy Duck, Tweety, Donald, and I'm sorry, Daffy and Bugs Bunny is over. Sylvester and Roadrunner are left.
Roadrunner.
Roadrunner. Last one. Okay, team 4. 35-year-old male, chronic alcoholic, presented to the medicine OP with fever and abdominal pain. It was a right upper quadrant pain. There was no jaundice. There was presence of tender, firm hepatomegaly. This is this CT scan. Look at it clearly. And now for the questions. The pounds is only for the third question. Name one polyxenic and one oxenic medium for Entamoeba histolytica. I want one polyxenic and one oxenic medium. Your 45 seconds for pounds starts now. And team 4, as soon as the 45 seconds is over, please give me your answer. I understand it's really late and you have to give me one polyxenic medium and one oxenic medium. You can't just give me one medium and stop. Only team 1 has pounds. Team 4, please start with your answers.
For aspiration, one is the age. Age if it is greater than 65. No, greater than 65, 55. 55. And if the
They've
diameter is
removed
greater
the
than
age
5
criteria. Cavity more than 5 centimeters. Accepted. Give
5
me more
centimeters.
indication. Give me
And
one more indication.
Medical therapy if it fails for greater than 7 days.
It's 4 days, but I'll still give it to you. Tell me some difference between pathogenic and non-pathogenic Entamoeba in terms of the trophocyte. And give me an example for one medium for polyxenic, one medium for oxenic. Any 3 microscopic differences. Any 3 is fine. You can even tell me antigen on the trophocyte.
I'm not sure about the polyxenic medium, but the axenic medium is TYS53.
Okay.
TYS53 medium is the axenic medium. Polyxenic medium, I'm not sure.
Okay. For the second question, you have only 10 more seconds. Try whatever you can.
Okay, there is toxicity in. Hello?
Yes?
There's toxicity in bacterial and there is no toxicity in toxic features in parasites.
I am not asking clinical features between pyogenic and amoebic liver abscess. I am asking on a saline mount, what is the difference between a pathogenic and non? Have you heard Entamoeba Moshowski, Bangladeshi? And what is the difference between that and Entamoeba histolytica? Your time's up, dude, but your indications for aspiration is correct. I'll give you 5 marks for that. And axenic medium, can you give me a reference from where you're saying that? That's only diamond, which I'm aware of. So if you We will talk. We will discuss about the third
I
question.
know the what all is present in the medium. So they use trypticase and yeast extract. So that's why it's called TYS.
Can you get the reference? I want only the reference.
Book. Can I just give it to you in some time?
You can give it later.
Yeah.
And
Okay, cool.
team 1 and team 3 both have pounds. Both of them gets +3. Team 3 MAMC, right? Yeah.
You say +3.
I'll repeat again. Team 1 and team 3 get their pounds correct, so they get +10. Team 4 gets only the aspiration correct, dude. I can only give you for the aspiration, which I'll give +5. Can we go to the hyperlink? If you can give me a reference for Aksinic, I'll give you half marks for that. Can we go to the hyperlink? +10 and +10 for both team 1 and team 3, +5 for team 4. Team 5, only Sylvester's left. I think we'll go ahead with that. Team 5, are you there?
Yes.
Hello, team 5. Okay. 65-year-old male was
Yes, we're there.
65-year-old. Okay, 65-year-old female presented with fever, breathlessness, which rapidly progressed to altered sensorium. This is the only history you have. There is no neck stiffness, no focal neurological deficit. Blood cultures were sent. Procalcitonin was elevated. Serum lactate was 4 mg per deciliter. I have given you the vitals, and I guess it's pretty clear. It's a diagnosis of a suspected sepsis. My question is very simple. What is the target mean arterial pressure in septic shock? Name any 2 empirical antibiotic regimens in a non-neutropenic patient. And what is the target blood glucose to initiate insulin? And what is the target blood glucose you want to maintain it in a sepsis patient? The third question is up for pounds. Your 45 seconds starts now. I want both the blood glucose level where you start insulin and the target blood glucose in a patient with suspected sepsis. And a probable septic shock. You have to give me both the blood glucose level where you'll start and the target. Don't give me one answer. I might give you negative. Team 4, Mysore Medical College has pounced. Team 5, please go ahead with your answer. You have 60 seconds to complete your answer. Team 5, please go ahead with your answer.
The first answer would be 65 to 75 mmHg.
65, excellent. First one is correct. Then.
And the blood glucose level to initiate is greater than 10 millimole and target is 7.8 to 10 millimole.
Great. Second question.
Second question, empirical
can you repeat your regimen, which the regimen you just said?
Wait a second.
Ampicillin, ampicillin plus gentamicin if MRSA is suspected, vanco is added.
Okay, you want in a suspected sepsis patient where it can be any organism, you want to start with ampicillin gentamicin. Fine, it's okay. Your first question, 65 is excellent. 65 is the correct answer. Blood glucose, yes. You have to start at 140 milligrams per deciliter. That is 10 millimoles. Target is 7.8 to 10. That is 120 to 140. I accept that. Empirical antibiotic regimen in Harrison, I was expecting either Piptas 4.5 mg QID or Cefepime. Ampigenta, I'm not. They've removed it from the 2021 surviving sepsis guidelines because Genta was associated with very high risk of AKI. I'm sorry, I cannot give you marks for the second question, but I'll give you 5. Team 5 gets plus 15. And in the pounds, Mysore Medical College, that is team 4 has answered it correctly. They get plus 10. Team 4 plus 10, team 5 plus 15. Can we proceed to the next set of hyperlinks? Team 1, please choose your hyperlink. We'll wrap this round up very quickly. Team 1, please choose your hyperlink.
Oswald, first one.
Oswald, okay, fine. 56-year-old female presented with high-grade fever, picket fence fever, flank pain for the past 2 days. There's presence of renal angle tenderness. Blood ABG blood glucose was sent. Urine was sent for microscopy and culture. Non-contrast CT was done, which showed renal parenchymal hyperintensity. Coming to the question, empirical antibiotic of choice, duration of treatment. First question. Second question, tell me the most specific test to differentiate Enterococcus faecalis and faecium. Most specific. And name the grading for emphysematous pyelonephritis. Only the name of the grading is more than enough. Your 45 seconds starts now. Team 1, as soon as the 45 seconds is over, please start telling your answer so that we can finish it fast.
I've pounced.
Yes, yes, sir. Yes, sir. I've seen.
Team 5 was also pounced.
Team 5 has pounced.
We have also pounced.
Even team 4 has it.
No.
Team 4, Team 5, Team 2, I have gotten your pounce answers. Team 3, if you have pounce, can you repeat your pounce?
To Roshan only.
To Roshan, yes. Team 3 alone, if you can repeat your pounce, it will be easy for us. Okay, accepted. Team 1, please start your answers.
For grading, it is Huang and Seng.
Excellent, plus 10. Next, first question and the second question.
Second is mannitol fermentation, means mannitols.
It's not the most specific, but I'll consider. Do you want to answer the first question? In a pyelonephritis, what is antibiotic of choice and what is the duration of treatment? You can either give me the latest one or the old one. Both I'll accept. Duration of treatment. And if you want to give 1 second, the patient's vitals are a bit off. You can't admit. So think and give me an answer. Do you want to say Cipro? You have 20 seconds. Just give your answer. You have 20 seconds. Whatever it is, please go ahead. You have 10 seconds. First question alone is unanswered.
Any IV cephalosporin, like ceftriaxone or something?
IV ceftriaxone for how long?
2 weeks.
Ideally,
IV for
the
1
duration
week.
of treatment is correct. Now, currently, ceftriaxone is not properly advocated. I will still give you +5 for that. I was expecting arabinose fermentation, but still mannitol, it's fine. I'll give you +5 for that also. All the teams have team 2, team 3, team 4, team 5. All of them have pounced correctly with a +10, and team 1 gets +10, +10, +5. So total of +20. Team 1 +20, rest of the teams +10. Can we go to the next question? Can we go to the hyperlinks? Okay. Team 2, please go ahead. Please choose a hyperlink.
Henry.
Okay. 46-year-old male presented with hemoptysis. He progressively developed constitutional symptoms, past history of TB with inadequate treatment. Clinical examination was near normal. Investigations were done, and he was found to be AFB sputum positive. My only question is, assuming he is INH monoresistant, give me the treatment regimen. Give me any two. There are 3 contraindications as per NTP. Give me any two contraindications for bedaquiline, and TB prophylaxis regimen for his family members. Mind you, he has INH monoresistance. He's previously treated INH monoresistant. Both the regimen should be suited for that. Prophylaxis also should be suited for that. Your 45 seconds starts now. Please, team, start bouncing. For the third question alone. I'll be very happy if you can give me the duration also for the prophylaxis.
Can you please go to the previous slide?
Hello, excuse me.
Yes.
It is showing that Roshan is not in the meeting.
1 second, 1 second. I have only got an answer from team 3. No, I don't think so. It still looks logged in. Team 1, okay, team 1 has pounced. You have 10 seconds left. Anyone has to pounce? I'll close the pounce. Okay. Can we go? Team 2, please give your answer.
Yeah. First thing, TB prophylaxis regimen for his contact. Since he is INH monoresistant, we can either go for a 4-month rifampicin regimen, 4R. Or we can go for 6 LFX, 6-month levofloxacin. That regimen we can go for.
Super. First and second.
First and second.
Less than 18 years and QT prolongation.
Less than 18 years, QT prolongation. Okay.
Pregnancy.
Regimen.
Regimen வந்துட்டு இந்த பேஷண்ட்டுக்கு RZD காமன் அதேதான் இன்டென்சிவ் ஃபேஸ் கண்டினியூஸ் ஃபேஸ் H ரெசிஸ்டன்ட்னால அதுக்கு பதிலா levofloxacin.
So 6 months continuous levofloxacin. Your regimen is correct. I'll give you +5 for that. Contraindication. It's currently QT prolongation. And the less than 18, right? 18, no, they haven't done studies. But still, pregnancy lactation. I'll give you that. But less than 18 also is currently a contraindication because there's no studies for that. So I'll give you +5 for that. Prophylaxis regimen, both are correct. Ideally, rifampicin is the 4 months. Rifampicin is the easiest. Team 1, team 3, you've given me 6 months levofloxacin. I will still take it as a correct answer. So team 1, team 3 both get +10. Team 2 gets +20. Team 1, team 3 both get +10. Team 2 gets +20. Can we go back to the hyperlinks? Team 3, please choose your hyperlink. Team 3, can you choose your hyperlink?
The penguin. Henry.
Henry was just taken. Henry Oswald is over. You can either choose Daisy, Madam Butterfly, or Weenie.
Butterfly. Then butterfly.
Yeah, okay. 51-year-old male farmer by occupation presented with generalized chronic seizures that happened a day ago. No history of weight loss. A known smoker. A serum electrolytes, blood glucose was sent. Blood glucose, serum electrolytes both were normal. An MRI was taken. This is your MRI image. Sorry. This is the imaging. And tell me 3 imaging points. It can be a CT point, MRI point to differentiate between neurocysticercosis and a tuberculoma. What is the anti-parasitic agents of choice? And just the name of the diagnostic criteria is enough. Your 45 seconds starts now. I don't, this is for team 3, right? I don't want the duration of treatment because duration is highly variable since every lesion has to calcify, right? So duration I don't want. Just give me the anti-parasitic agents of choice. I'll be happy if you can give me whatever drugs do you want to give for this patient. If you can give me that also, I'm fine. More 20 seconds. Anyone else has to pounce? Only team 2 has pounced.
Circular lesion है तुम्हारा with central scolex. और एक वो मिल सकता है
once again, the 45 seconds for pounce is not over. Okay, the 45 seconds for pounce is over. Team Mysore Medical College has pounced. Yeah, team number 3, please go ahead with your answer. Team 3, please go ahead with your answer. Yeah, please. Team 3, answer. I thought you started saying
in the first point, the Tuberculoma has conglomerate lesions where NCC has a single discrete lesion.
Excellent, excellent.
NCC has a peripheral ring enhancing lesion with a central scolex, but there is nothing such in
I'll give you that.
tuberculoma.
Okay.
In late stages of NCC, it can present as a discrete calcified nodule, whereas tuberculoma will not present like that.
Do you want to give me one more? The third one is not exactly correct. Do you want to give me one more imaging point? Two of the imaging points are correct. Give me one more and tell me the criteria and tell me the antiparasitic agents of choice. You have 30 seconds to finish your answer.
Agents is albendazole.
Excellent. Any other drug in case there are more than 2 cysts?
Madam, we'll give steroids. Also, we'll give phenytoin also. And
Okay, fine. Name the diagnostic criteria.
ESBO criteria for the radiological diagnosis.
Escobar is the pathological staging, which divides into 4
revised
revised Elbruto's criteria. Your diagnostic criteria is correct. I'll give you 10 points for that. Antiparasitic agent albendazole is correct. More than 2 cysts, you have to start praziquantel. But albendazole, I'll give you that. Imaging, you've given me 2 points. Do you want to complete? You have 10 seconds left. Give me one more imaging difference between your
Vesicular lesion होगा तो maybe फिर enhancement आ रही है.
You already told me cystin dot vesicular is 1 point. You have merely 5 seconds left. Just give me one more point.
In the vesicular
single multiple. नहीं but ये vesicular
single multiple. It's not a very strong answer. But I'll still give you that. I'll give you +5 for the imaging, +5 for the antiparasitic agent of choice, 10 for the diagnostic criteria. And in the pounds, team 2 has given modified Elbruto and Mysore Medical College. Team 4 also has given. So team 2, team 4 gets +10. Team 3 gets +20. Team 2, team 4 +10. Team 3 +20. Can we go back to the hyperlinks? Now it's team 4's chance. Please choose your hyperlink.
Daisy.
8-year-old boy admitted at the hospital with intermittent fever. He was diagnosed to have HIV during a pre-op screening for a surgical procedure. He was initiated on medication.
The previous question for 30 marks or?
No. I haven't given 30 to anyone. It's +5 and 10. I haven't given 30 to anyone. I will repeat the scores if you want. Team 2, team 4 +10, team 3 +20. Okay. 8-year-old boy, known case of HIV. He's lost 17 kgs. Current weight is 23 kgs. CD4 count is 150 cells per millimeter cube. That's a rash with eosinophilic infiltrates. That's fine. Now the question for pounds is true or false. I want both. The third question is up for pounds. Your 45 seconds for pounds starts now. This is for team 4, right? Team 4 at the end of 44 seconds. Please give me your answer immediately. Give me as one answer, both for A and B. The pounds window is over. Team 4, please give me your answer. Team 4, give me your answer. Team 4, please give me. Yeah, CDC grade is?
CD, this one, B, BSc.
Either give me the give me the CDC grade. Okay. Please start answering the question. Team 4, please answer your question. Please start answering.
What was the CD? This one, CD4 count.
You don't have CD4 count is 150. You don't have to give me A, B, or C.
Stage 3. CD4 corrected stage 3.
Stage 3. Excellent. Next. What is the regimen? 8-year-old, 23 kgs. You have 30 seconds. Please go ahead with your answer. Third one.
Third one, first one is false. It's subcutaneous.
The second one. Okay.
Yeah, third one A is false. B is true.
Maravirac is used only for HIV one. Are you sure? Both of them are false. Can you give me the regimen?
Is it?
Give me the regimen. I can't hear you. Can you give me the regimen again? Hello, team 4 regimen.
CD. 3 both are false, sir.
You already give me. You already said Maravirac is used only for HIV. Please give me the second question. Give me the regimen. You have 10 seconds left. Give me the regimen quickly. Team 4 regimen. He's 8 years old, 23 kg. So can we close if you're not giving, or do you want to attempt the question? There's no negative. Attempt. Hello, team 4, are you there? Your time's up, team 4. But your CDC grade is correct. I'll give you +5 for your CDC grade. Infevertide subcutaneous, I'll give you +5 for that. And coming to the pounds, team 1 has given Maravirac has given false and true. Team 1 gets -10, team 2 gets -10, team 3 gets +10, team 4 gets +10. I'll repeat. Team 1 gets -10, team 2 gets -10, team 3 gets +10, team 4 also gets +10. Can we go to the hyperlink? Team 5, there's only one character of Veenie is left. Can we go ahead with that? Are you there?
Yes.
Yeah, we'll go ahead with that then. A 70-year-old female present with the ENT OPD. It's a squamosal CSOM. Now presenting with new onset headache. That too early morning. No focal neurological deficit. Cerebral examination was normal, but there were the vitals are given. Look at the vitals. ENT examination was done. Reconfirmed the presence of an aortic cholesteatoma, but the patient has new onset headache. But just in case, the ENT department went again with the CT. This is the CT finding. Now, can you go to the question? What? No, the question for Pounds is name the 4 stages of a brain abscess. 45 seconds for Pounds starts now. I want all the 4 stages. I'll be happy if you can give me the duration for each stage, if you can. Alena, since there's less time, just give me the 4 name stages. That's all. And team 5, as soon as the 45 seconds is over, I am expecting an answer. Advantages of LP. LP is lumbar puncture. Yeah, the 45 seconds is over. Pounds is closed. Team 5, please answer your question. Team 5, are you there?
The 4 stages of brain abscess are early cerebritis, late cerebritis, early capsule formation, and late capsule formation.
Excellent. The first 2 questions.
Second question. In case of secondaries, there will be multiple as compared to solitary lesion here. Also, the location will be parietal rather than temporal.
Sometimes there are some malignancies where there can be a corticomedullary, a gray matter white matter junction, which can be temporal. Can you give me any other finding? Don't actually in real life we never use sight, right? We use either.
Okay, so first we'll first answer the first question. First it can be like
brain abscess.
Yeah. First, a quick and stat test can be done to rule out sigmoid sinus thrombosis. And
in a CT which shows a brain abscess, do you want to do a lumbar puncture? In a CT that shows a space occupying lesion, will you do a lumbar puncture? That's my only question.
If ICP is raised, then we won't do it. But since the question just asked the advantages.
that was a trick question. Lumbar puncture has no role in a space occupying lesion. It is a clear brain abscess. Harrison clearly says in a brain abscess, no role for lumbar puncture. Neither diagnostic nor therapeutic. It is contraindicated. Only risk of coning. First question I can't give you. Do you want to give me one more imaging difference? Your stages of brain abscess are correct. Can you give me one more imaging difference? Site I cannot accept. Anything else? Diffusion weighted imaging or anything else? You have 10 seconds.
MR spectroscopy changes.
What MR spectroscopy change? What peak? How are you going to differentiate?
Lipid peak in necrot.
There in both. It's okay, fine. I will give you lipid peak is there in both, but still I'll give you +5 for the imaging. Lumbar puncture I cannot give you. Stages I'll give you +10. For the pounds, team 2 gets +10. Team 3 also gets +10. Team 1, it's a misspell, but I'll still give you +10 for team 1. So team 1, team 2, team 3, team 4 all get +10 for the pounds. Team 5 only gets +15. Is that clear? Team 1, team 2, team 3, team 4 get +10. Team 5 get +15. Thank you for your patience. The 5th round is over.
Is this the last round or?
There is one more. There's one more last round.
Scores will be updated. Please say shortly.
Participants, please check the scores.
Hello.
Everyone's scores are given.
Actually, I think our team 4 it is 443.
43.
Total
mistake.
We will get back to you soon shortly.
పక్కనే అని
I have one doubt with this round score. Anybody is there? Hello.
Yes, sir.
In the round when both of our direct questions we got fully correct 2020. One on the TB question, இன்னொன்னு infective endocarditis question.
Okay, sir.
That should be 40.
Okay.
And whatever we have pounced, you told plus 10 minus 10. So how is 75 coming?
Sir,
இல்ல அந்த 40 வந்துருச்சு.
இது கரெக்டா Hello, sir. Praveen, sir.
சொல்லு.
Sir, you answered question 2 and question 7 direct questions right, and you got 20, 20, 40.
ஆமா.
And pounds for 3, 6, 8, 9 and 10 and got 9 round.
Correct.
And got 9.
You counts for 2. Sorry, you counts for 3, 6, 8, 9, and 10.
Okay.
And you got 9 alone wrong.
Okay.
So totally your score is 70 now in this round alone.
We also have a small doubt if the score should be.
No, we got part marks for the 9th question. True or false. First one was right.
राउंड के हैं पिछले
नहीं
राउंड
नहीं
के
20 इसमें 20 एक ही होगा
तो रिकॉर्ड भी सीखा मैंने आपके
देखो 20
Ma'am, Sukrit ma'am.
Yeah, and the 9th question,
Ma'am, the quizmaster has allotted marks only if you had answered both as false. No part marks for that. So minus 10 if you had answered even one as true. Is it clear, ma'am?
Cool.
Excuse me.
Which team is this?
Team 3.
Yeah, go on.
We are having
in our own question we had received 15 marks.
That is not added.
So it should be some multiple of 5. It should be something into 10 plus 15.
You got your direct questions plus 15 and plus 20 in one. Yeah. 1 minute. Let me check. Wait, 1 minute.
20 मतलब 7 सही जो हुए उसमें 6 into 10 plus 1 into 20 plus 15 ऐसे बनेगा.
Team 3. Hello, team 3.
Yes. Hello.
If I
but first or second team लड़ेंगी team now.
Hello, team 3. Hello.
Yes, please continue.
Yeah, for this round you are getting 85 marks.
Okay.
Is it okay? Or everyone score fine now?
Yes.
Can we move on to next round? This is the final score. Okay, we'll move on to the final and last round. Is everyone satisfied with the score? Please respond. Okay, moving on to the last round.
Can we please continue?
Please try to wrap it up quickly because it's getting very late. Hello.
Round will last no more than 20 minutes. Please wait for 2 minutes for us to get into the last round. I request the Revenging Warrior Baladitya to start with the last round.
Sorry for the delay. Let's get to the last round of the Infesto. It's a walk in the walk. Actually, this round deals with the epidemiological aspects of the infectious diseases. So let's get on the rules of the quiz. So there are 9 questions in this round, which each carrying 10 points, and there will be no negative points for the wrong answer or failing to attempt the questions. All the teams are allowed to attempt the question, and no direct question this round. So, and each question has a time limit of 1 minute, before which the teams are expected to answer to the quiz master via chat, which is Baladitya. Queries regarding the question and answer will be discussed at the end of the round to avoid the disruption of flow of the round. So, partial marks will be decided by the quiz master. Any questions regarding the rules?
Who should we send it to? The answers?
Bala Adityayam.
Huh?
Bala Adityayam.
Okay.
Please send the answers to Bala Adityayam. Can everyone message me? Team 1?
Yes.
Can you? Are you clear with the rules?
Yes.
Okay, let's get to the first question. The time starts with the once the question is displayed. Time starts now. Malaria is one of the dread diseases in our country. And NVBDCP is implemented the same. It has introduced IVM, which includes indoor respiratory spraying.
Whom do we have to send a message to?
Bala Aditya M. Am I clear to everyone? Please send a message to Bala Aditya. Which index is used to assess the operational efficiency? Which index is used to plan the control measures in an area? And name any 2 health programs which are integrated with NVDCP.
Oh, hey,
10 seconds more. Time closes. Next slide, please.
Team 4, Mysore and Team 4.
So the answers for the first question is first for ABR is used to assess the operational efficiency, and the APA is used to decide the control measures in area, and the 2 health programs which are integrated with NBPs, Integrated Disease Surveillance Project, and JSY. So the scores for the first question is: Team 1 scores 5 points, Team 2 scores 5 points, Team 3 scores 5 points, Team 4 scores 2.5 points, and Team 5 scores 5 points. Am I clear to everyone? Hello? Can anyone respond about the...
Please continue.
Next question.
Move on.
Time starts now. Chronic carriers is the one who excrete infectious agent for indefinite periods, and they are more important than cases as long as the carrier state more risk to the community. Such carrier states are seen in many diseases, and one among them is typhoid fever. Many of the sites of infection in chronic carriers are typhoid fever. Which strain of salmonella is used to identify the carrier state, and best method to treat the chronic carriers of typhoid fever? I need 2 sites of infection. One is not enough.
We have just added one more of the sites.
Antibiotic.
Sorry?
We have sent the second site.
Okay.
Team 1.
Time closes.
Second one after the second site.
Okay. So the answers for the question 2 is urinary blood and gallbladder are the sites of infection, and Bartlenger strain is used to identify the carrier state, and best method is cholecystectomy plus concomitant amplification therapy. The scores are: first team scores 7.5 points, second team 2 scores 5 points, team 3 scores 7.5 points, team 4 scores 2.5 points, and team 5 scores 10 points. I could not accept ciprofloxacin as an answer because the best method is cholecystectomy plus concomitant ampicillin therapy. And did not accept the on cholecystectomy as a sole answer because concomitant ampicillin is also should also be mentioned. Next question, please. Time starts now. Yellow fever is a zoonotic disease caused by an arbovirus. The spectrum of disease varies from clinically indeterminate to severe cases and sometimes share with other viral hemorrhagic fevers. Which zone of hepatocyte is mainly involved in yellow fever? If a traveler from endemic zone of yellow fever does not have certificate of vaccination against yellow fever, as a community medicine specialist, what will you do? Expand eye strategy. Ten seconds more. Team 3 done. Time closes. Don't. So the answers are zone 2 is the zone 2 episode. Zone 2 the episode is mainly involved in yellow fever, and you have to quarantine the traveler for 6 days in a mosquito-proof room, and IS elimination of yellow fever epidemic. The scores are team 1 scores 5 points, team 2 scores 10 points, team 3 scores 5 points, team 4 scores 10 points, and team 5 scores 2.5 points.
Excuse me. Zone 2 is middle zone only, so we should get 5 points.
Also, we have also answered 2 questions correctly. So one for 5 marks and one for 2.5 marks.
We have the duration we have chosen was 10 days because the vaccination certificate is issued after that. But we have said about quarantine only.
Sorry?
We have mentioned quarantine only as the strategy along with vaccination. And the duration we have given is 10 days, but the strategy is the same.
Okay, but you didn't mention the time duration of the quarantine, no?
No, we said 10 days. You see.
You are team 3, right?
Yes, yes.
You didn't mention time actually. Okay.
No, if you see.
Okay. But quarantine for 6 days only is, will be the apt one, no?
But if 6 gets extended to 10, that will not. Because if we give vaccine also after 10 days, we can also issue the vaccine certificate. I feel.
Okay, I will get back to you shortly regarding the question.
Excuse me, what about the zone of the hepatocyte? Mid-zonal necrosis, I mean, that's the same as zone 2.
Yeah. Yes, correct.
So
mid zone is zone 2 actually.
Yeah, so we'll get 5 points, right? We answered I correctly and the zone correctly. Team 5.
1 minute.
Hello.
Okay. Yeah. There is a change in the score for team 5. It's actually 5 points.
Thank you.
Any other queries in this question? Time starts. No. A 34-year-old male, known case of AIDS on heart therapy, came for regular checkup. On investigations, it was found that his CD4 cells were below critical value X. So you started primary prophylaxis with drug Y for preventing the disease. What is X? If a patient developed allergy to drug Y, what are the alternative treatments would you administer? When will you stop the prophylaxis? I need some specific answer for the last question. I didn't ask about the drug Y actually. So no use in mentioning the drug Y. The question, there is no question related to drug Y actually. Time stops now, so no more answers. Only team 1, 3, and 5 have been give the answer. So no. And team
I've also
team
given.
2,
I've also
team
given.
2, team 2. So
We have
no
also
more,
given
no
one of. We have mentioned the limit of cells.
Team 1, 3, 5, and 4. Team 1, 2, 3, 5. Sorry. Right? Okay, team 1 has not scored any points. Actually, the answer for the excess 350 cells per millimeter cube. And team 2 scores 5 points. Team 3 scores 2.5 points, and team 5 scores 5 points.
Why we are not getting 7.5?
Because one of the alternatives is desensitization protocol for cotrimoxazole, according to NACO guidelines.
But then alternative dapsone is also correct, right?
That's why 2.5 and 2.5, 5 marks.
The other thing can be pentamidine, right? If he goes for severe PCP, pentamidine is the
when the patient develops allergy, you have to start desensitization protocol only. Cannot go for a severe first.
What is the X?
Sorry?
Is the answer for X?
X is 350. You have mentioned 200.
Okay.
So team 2 scores 5 points for fourth question. Team 2 scores 5 points. Team 3 scores 2.5 points, and team 5 scores 5 points. Next question. So time starts now. You have to match this. This is a match question. So please send it in one message. Don't send in different messages.
Please give us more time then. Or you should have done 1, 2, 3, 4 ABCD something.
1, 2, 3, 4 and ABCD in left and 1, 2, 3, 4, 5 in right. Okay. Left side column is ABCD and right side column is 1, 2, 3, 4, 5. I will extend 30 seconds more. Please send in a single message.
The maximum limit till which it is isolated or the minimum one?
It's a minimum only. It's a minimum only. தப்பு 2F இல்ல 3C இல்ல 4D கரெக்ட் Team 5 over. Team 1 வந்து FP 3 weeks. No more bones. Time ends, no more answers. Team 3, can you? Team 3?
What?
For C option, which one did you choose? There is only 6 options provided, but you have said 7. I can't provide marks for that.
Chicken pox. ये गलत हो गया.
I can't provide marks for that.
C का 4 नहीं, 7 days after. C का 2 आप मान लो. Yes, sir.
So the answer is hepatitis A for 3 weeks, influenza is for 3 days after onset of symptoms, chickenpox is 8 days after onset of prodromal symptoms, and rubella is 7 days after onset of rash. So team 1 scores 5 points, 2 correct. Team 2 scores 2.5. Team 3 scores 5 points, team 4 scores 7.5 points, and team 5 scores 2.5 points. Any queries regarding the scores?
Can you repeat the score?
Team 1 scores 5 points, team 2 scores 2.5 points, team 3 scores 5 points, team 4 scores 7.5 points, and team 5 scores 2.5 points.
Can you repeat the answer?
We're from team 4.
Yeah.
I just said consider the last 4.
Last 4 means I couldn't understand. Can you repeat?
Can you just check our DMs again? I just asked you to consider last 4 of what I had sent.
Yeah, I answered that only. 1 correct, 3 wrong. It's like 3 correct, 1 wrong.
Okay.
Can you repeat the answers once again?
Hepatitis A is 3 weeks. Influenza is 3 days after onset of symptoms. Chickenpox is 8 days after onset of prodromal symptoms, and rubella is 7 days after onset of rash. Team 4 are provided chickenpox as 5 days after onset, so it's a wrong answer. We'll go to the next question. Your time starts now. You are working as a medical officer in the PHC. The staff nurse complains to you that the basket of 5-strand refrigerant is missing. So basket is important thing to prevent the freeze damage. So what will you do to protect these vaccines in this situation? And name any 2 licensed vaccines, and that's a question next slide. So please. So which of the following can be reused in next vaccine camps based on WHO recommendation? The clue is it's related to a vaccine while monitoring. You can answer it as a color coding. Any which among these 3 colors can be reused as you can answer in that way. You kindly request everyone to send in a single message. Answer all the 3 in single message, please. Time's up. So no more answers. Team 1, 2, 3, 4 has been answered. Team 5 has not answered.
Can you please show the previous slide? Because
We answered.
We answered way
Yeah,
before
yeah,
you
okay.
said time.
Yeah. The answers are you have to place 2 layers of empty ice packs. Actually, I need specific answer. It's empty ice packs, and for second one is everyone have answered correctly. BCG, MMR vaccine, measles, everything is fine. And third question is blue color virus eligible to reuse next vaccine camp. Vaccine viral monitor mentioned in the body of the viral issue is considered. So scores are for the sixth question. Team 1 scores 7.5 points. Team 2 scores 7.5. Team 3 scores 7.5. Team 4 scores 7.5 and Team 5 scores 7.5. Any queries regarding scores? So, okay, we'll go to the next question. I request everyone please send the messages in a single message. There is 1 minute time, so you can actually send message on single message so that it will be easier for us to correct actually. So time starts now. During the course of leprosy, immunologically mediated episodes of acute or subacute inflammation known as reactions can occur, which are of 2 types. In which type the following question is seen? In what way regimen for type 1 reaction differs if it occurs along with neuritis? If a patient develops reactions during MDT, what would you do? You will decrease the dosage, discontinue or continue the MDT. The time is up. No more answers. Team 2, last question cannot be accepted. Last answer cannot be accepted. The answer is it's a type 1 reaction. Actually, in A type 1 regimen for type 1 is prednisolone starting from 40 mg for every 2 weeks you will decrease the dosage. If neuritis is also coexist, you have to prolong the therapy for 4 weeks from 20 mg. This is the actual answer I needed. And for last question, you have to continue the MDT. So scores for this seventh question is team 1 scores 2.5 points, team 2 scores 2.5, team 3 scores 2.5, team 4 scores 5, and team 5 scores 2.5. Any queries regarding the scores? Team 2, you have answered the first question after the time, and so cannot, and actually you changed the answer, so I cannot answer. I cannot provide marks for that question. So okay, then we can go to next question. So time starts now. P is an insecticide extracted from the Bluestone flowers. We'll get back to the image shortly. It has 4 active principles and belong to category A based on its mechanism of action, and it is used as a space spray for which process B is needed for effective action. Even though P is widely used in the past, it is considerably replaced by DDT because of an additional feature C which is not seen in P. So identify P, A, B, C. If you want to show the previous slide, you can mention. Please answer everything in single message.
For the previous slide, please.
Question, please.
I repeat, please answer everything in a single message. Time ends up, no more answers. Answers is P is pyrethroids, and A is contact poison, and B So the answers are P is pyrethroids, A is contact poison, B is atomization, and C is residual effect. As everyone join, team 1, team 2, team 3, team 4, team 5. You can react in chat. So the
To whom do we have to send the message?
same Baladitya 4
Team 2 present.
team 1 team 1
Please, can you move on to the next question? It's been 5 hours already.
sorry, team 1 has 4 videos, so we'll get back. We'll restart the round in 1 minute. The scores for the 8th question is team 1 5 points, team 2 2.5, team 3 2.5, and team 4 no score 5 2.5. Team 5 is 5. Sorry. I repeat, team 2 is 2.5, team 3 is 2.5, team 4 0, and team 5 is 5. Next question. The last question of this round. Time starts now. A 32-year-old Mr. Ravi, a known case of sputum-negative pulmonary TB, has started his intensification therapy a month ago. Presented with chief complaints of abdomen pain, vomiting for a week, and yellowing of sclera. And lab investigations reveal the following levels. Is diagnosed as a ATT-induced hepatitis and managed by the same. When will you reintroduce ATT to the patient? Name 2 methods of reintroducing ATT drugs and how many hepatitis drugs one can administer to a patient having all the 3 lab parameters. And once again, I remind and to send the message as a single message. எங்கடா போய் பார்க்குற மெசேஜஸ் ஆரம்பம்னா ஏறம்பம்னா time ends up, so no more answers. So the answer is AST, ALT, and bilirubin should be below normal levels. Actually, AST and ALT less than 2 times the upper level limit. And the two methods are sequential and incremental methods. And the maximum number of hypothetical drug is 1 actually. So team 1 scores 0 points, team 2 scores 3.5. I have allotted partial marks for team 2 for first question. Since you mentioned AST and bilirubin and did not mention about ALT. And team 3 is 0, team 4 2.5, and team 5 0.
We mentioned the sequential method, and we also said the order in which we should suspect which drug is responsible for. This is from team 3. Hello.
Hello, excuse me. This is team 5.
Can you repeat, please? Hello?
Team 3 or team 5? Which one are you?
Can you repeat, please?
Yeah,
Which
team
team
5
are you
has a
addressing?
query.
Yeah, till.
Okay, so
Yes,
team
please.
5 has a query. Can we have written ALT AST less than 2 times of normal? Can you please check it?
Team 5 only, right?
Question 1. Yeah.
Please check the team 3 response also while you have it.
Sorry for that. I missed the answer. So I'll award partial marks for the team 5 first question. 1 mark will be allotted.
Please check team 3's response also. We have mentioned the sequential method.
I have mentioned sequential desensitization. I asked how will you reintroduce the drug? You have to discontinue all the drugs at a time actually. It's not sequential desensitization.
No, so that is what we mentioned. What are the suspects? Also, if you see, like first pyrazinamide is the most hepatotoxic. Then
no, I can't accept the answer. Team 4. Team 4. Can you mention the source of your answer? Hello.
Which one? The second one you are telling, right?
Yeah. How will you reintroduce the drug?
It's ATS, BATS. One is sequential and one is one after the other. I mean, that's what I've even typed, right? Whatever you said is what I've typed. I've said one drug together at full dosage and one more is introduced sequentially.
Okay. Thank you.
Hello guys, this is Marathe academic secretary this year, final year. Here are we at the end of the quiz. We'll have results in few minutes. Thank you for your patience for attending this 5 hours quiz. It is nice to see interns spending time to attend this quiz. Hope you guys will attend the main event also. It is on September 14 to 17. Even if it is not possible, I request you to attend, like ask your juniors to attend the main event. For it's a 4-day event. Here are the results. Third place goes to BJMC Ahmedabad. And the second place goes to Madras Medical College. And the first place, winner of Infesto, Mysore Medical College.
Congratulations.
Congratulations.
We hope you had a wonderful time quizzing with us.
Congratulations.
We are extremely sorry for the delays from our side. We hope you all learned something from this quiz and hope to see you in future quizzes that MMC conducts. Thank you so much. As announced earlier, we will be giving cash prizes to the top 3 teams and free entry to Mysore Medical College, our main event. Thank you, everyone. Have a good night.
Congrats.